2026 CNA Practice Test 2026 Part 1. Question 1. Which of the following is the nursing assistant most likely to observe in a resident who has low blood sugar? Option A, shakiness or trembling. Option B, thirst and dry mouth. Option C, sweet breath odor. Option D, increased urine output. The correct answer is option A, shakiness or trembling. Shakiness, sweating, and confusion are common early signs of hypoglycemia, or low blood sugar. Question 2. Residents are most likely to feel the urge to have a bowel movement at which time? Option A, after taking a nap. Option B, after eating a meal. Option C, just before bedtime. Option D, during the shift change. The correct answer is option B, after eating a meal. Eating stimulates the gastrocolic reflex, which often results in the urge to defecate shortly after a meal. Question 3. Before helping a resident to stand who has been lying in bed, the nursing assistant should do what? Option A, find out what the resident plans to do for the day. Option B, make sure a walker is available for support. Option C, ask if the resident has taken any medication recently. Option D, allow time for the resident to adjust to sitting at the edge of the bed. The correct answer is option D, allow time for the resident to adjust to sitting at the edge of the bed. Dangling the legs at the bedside prevents dizziness caused by orthostatic hypotension when moving from lying to standing. Question 4. While helping a resident get dressed, you notice their breathing is faster and they feel tired. What is your first action? Option A, dress the resident quickly to get it over with. Option B, check the resident's vital signs. Option C, stop the dressing to let the resident rest. Option D, go to find a nurse to check the resident. The correct answer is option C, stop the dressing to let the resident rest. The immediate priority is to stop the exertion and allow the resident to recover their breath before continuing or seeking further help. Question 5. When planning priorities at the start of a shift, what is the most important task for a nursing assistant? Option A, decide break times with other nursing assistants. Option B, review assignments to check if residents are divided evenly. Option C, check all assigned residents to see if anyone has immediate needs. Option D, check what the activity department has scheduled. The correct answer is option C, check all assigned residents to see if anyone has immediate needs. The initial rounds allow the assistant to identify safety concerns or urgent care needs before beginning routine tasks. Question 6. A resident refuses to go for their scheduled walk at 10 a.m. What is the best response? Option A, maybe you can plan to walk a little further this afternoon. Option B, the doctor ordered your exercise and you really need to try. Option C, you have the right to refuse and I will tell the nurse. Option D, would you prefer to walk a little later? The correct answer is option D, would you prefer to walk a little later? Offering a choice in timing respects the resident's right to refuse while still encouraging them to meet their healthcare goals. Question 7. Which of the following is generally experienced by a resident with low blood sugar? Option A, fever. Option B, weakness. Option C, sour breath. Option D, frequent urination. The correct answer is option B, weakness. Low blood sugar deprives the body of energy, leading to symptoms like weakness, dizziness, and trembling. Question 8. An alert resident has requested to be left alone with her husband who is visiting. What should the nursing assistant do? Option A, allow the resident to be alone with her spouse. Option B, suggest that the husband take the resident home for a visit. Option C, explain that facility policies do not allow for this type of visiting. Option D, remind the resident that this is a nursing home and not a hotel. The correct answer is option A, allow the resident to be alone with her spouse. Residents have a legal right to private visits and intimacy with their spouses in a long-term care facility. Question 9. When a resident is dark-skinned, the first signs of skin breakdown may appear in which color? Option A, black. Option B, green. Option C, purple. Option D, white. The correct answer is option C, purple. In darker skin tones, redness may not be visible. Instead, look for purple, blue, or dark brown discolorations. Question 10. Which of the following foods are typically found on a high-protein diet? Option A, pasta and rice. Option B, meat and eggs. Option C, fruits and vegetables. Option D, whole grains and milk products. The correct answer is option B, meat and eggs. Protein is found in high concentrations in animal products like meat, eggs, and dairy, as well as in beans and nuts. Question 11. A resident says she is 5 feet 6 inches tall, but you measure her at 5 feet 4 inches. What should you do? Option A, record the height as 5 feet 4 inches. Option B, record the height as 5 feet 6 inches. Option C, explain that older people shrink with aging. Option D, measure the resident again. The correct answer is option D, measure the resident again. When there is a discrepancy between a report and a measurement, rechecking ensures the data is accurate before it is recorded. Question 12. The use of a physical restraint is intended to do what? Option A, control a resident's behavior. Option B, protect the resident from injury. Option C, make staff members' jobs easier. Option D, decrease how often staff need to check the resident. The correct answer is option B, protect the resident from injury. Restraints are safety devices used as a last resort to prevent a resident from harming themselves or others. Question 13. A resident with a hearing aid keeps asking you to repeat information. What should you do first? Option A, speak loudly and directly into the hearing aid. Option B, check that the hearing aid is in the correct ear. Option C, ask when the hearing aid battery was replaced. Option D, make sure the hearing aid is turned on. The correct answer is option D, make sure the hearing aid is turned on. Troubleshooting equipment begins with the most basic steps, such as checking for power and proper volume settings. Question 14. Where is the appropriate place for a thermometer to be kept for a resident in isolation? Option A, at the nurse's station. Option B, on the isolation cart outside the room. Option C, in the dirty utility room. Option D, in the resident's room. The correct answer is option D, in the resident's room. Keeping dedicated equipment in the isolation room prevents the transfer of pathogens to other areas of the facility. Question 15. What is the best reason for giving frequent perineal care to residents? Option A, it increases comfort. Option B, it decreases sexual responses. Option C, it helps prevent skin breakdown. Option D, it prevents incontinence. The correct answer is option C, it helps prevent skin breakdown. Removing urine and feces is essential because the moisture and acidity of waste can quickly damage the skin. Question 16. The first step a nursing assistant should take when discovering a fire is to do what? Option A, check how quickly the fire is spreading. Option B, remove any residents near the fire. Option C, throw a blanket over the flames. Option D, pull the fire alarm. The correct answer is option B, remove any residents near the fire. The rescue, alarm, confine, extinguish acronym prioritizes the immediate safety of the residents. Question 17. To help prevent burns to residents during meals, the nursing assistant should do what? Option A, place a clothing protector on the resident. Option B, wait to serve the food until hot food is cold. Option C, add ice to any hot liquids like coffee or soup. Option D, let residents know which foods and beverages are hot. The correct answer is option D, let residents know which foods and beverages are hot. Effective communication helps residents handle their own meals safely while being aware of temperature risks. Question 18. A resident tells the nursing assistant about being bored. What should the assistant do? Option A, tell the resident that your days seem long too. Option B, ask the charge nurse if the resident can have some medication. Option C, ask about activities the resident has enjoyed in the past. Option D, tell the resident to check the activity schedule. The correct answer is option C, ask about activities the resident has enjoyed in the past. Engaging the resident in conversation about their interests helps identify personalized ways to improve their quality of life. Question 19. Why is it important to check the feet of a resident with diabetes at least once a day? Option A, to look for sores on the feet the resident may not feel. Option B, to check if vision problems have resulted in foot injuries. Option C, to trim the toenails so they do not become long or jagged. Option D, to make sure the resident does not get a foot fungus. The correct answer is option A, to look for sores on the feet the resident may not feel. Diabetes can cause nerve damage, meaning a resident might not feel an injury that could lead to a serious infection. Question 20. A resident's hands shake when trying to drink liquids. What is the best response? Option A, thicken the liquid so it will not spill. Option B, place a clothing protector on the resident. Option C, seat the resident with others who also spill. Option D, suggest the resident might do well with a cup with a lid. The correct answer is option D, suggest the resident might do well with a cup with a lid. Using adaptive equipment like a lidded cup allows the resident to remain independent despite their tremors. Question 21. A confused resident needs more help with dressing today than usual. What should the nursing assistant do? Option A, tell the resident not to feel bad about needing more help. Option B, provide extra help as needed to avoid frustration. Option C, ask if they would prefer to stay in night clothes for the day. Option D, check if the resident will get dressed for another assistant. The correct answer is option B, provide extra help as needed to avoid frustration. Care should be adapted to the resident's current functional level to maintain their emotional well-being. Question 22. A resident on bed rest needs a bedpan but cannot lift their hips. What is the best action? Option A, ask the nurse if the resident should have a catheter. Option B, turn the resident onto their side to place the bedpan. Option C, place an underpad or brief to collect the urine. Option D, have another assistant help lift the resident. The correct answer is option B, turn the resident onto their side to place the bedpan. Rolling the resident is the safest and most comfortable way to place a bedpan for those with limited mobility. Question 23. A resident grabs his throat and cannot speak during mealtime. What should you do first? Option A, try to get the resident to take a few sips of water. Option B, provide abdominal thrusts from behind. Option C, pat the back and reach in the mouth for the blockage. Option D, ask the resident to take a deep breath and cough. The correct answer is option B, provide abdominal thrusts from behind. Inability to speak and grabbing the throat indicate a complete airway obstruction requiring the Heimlich maneuver. Question 24. A resident is in rehab after a stroke and plans to return home. How can you best support them? Option A, provide total care for the resident. Option B, set high standards for the resident's achievements. Option C, help the resident focus on even small accomplishments. Option D, remind them they will be happier when they are home. The correct answer is option C, help the resident focus on even small accomplishments. Positive reinforcement of small gains helps maintain the resident's motivation during the difficult recovery process. Question 25. A usually alert resident is having difficulty remembering where he is today. What should you do first? Option A, increase the resident's fluids since dehydration causes confusion. Option B, consider that memory loss is a normal part of aging. Option C, ask where the resident believes he is. Option D, report the change to the charge nurse. The correct answer is option D, report the change to the charge nurse. Sudden confusion is not a normal part of aging and could indicate a medical emergency like an infection or stroke. Question 26. A resident has a finished seizure and is breathing. What should the nursing assistant do next? Option A, get the emergency cart. Option B, turn the resident onto her side. Option C, check if the resident is able to talk. Option D, help the resident back into the chair. The correct answer is option B, turn the resident onto her side. The recovery position prevents the resident from choking on saliva or vomit after a seizure. Question 27. Which action shows correct handling of a urinary drainage bag for a resident in bed? Option A, hang the bag higher than the level of the resident's bladder. Option B, use the measurements on the bag to measure urine output. Option C, raise the bed to the highest position for drainage. Option D, wear gloves when emptying the urinary drainage bag. The correct answer is option D, wear gloves when emptying the urinary drainage bag. Standard precautions require gloves when handling body fluids to prevent the spread of infection. Question 28. A resident wears a hand splint. Which observation should you report to the nurse immediately? Option A, the resident's fingers are cold and blue in color. Option B, the splint was removed as scheduled in the care plan. Option C, the resident asks to have the splint removed for a few minutes. Option D, the resident asks to reposition the arm with the splint. The correct answer is option A, The resident's fingers are cold and blue in color. Discoloration and cold skin indicate that the splint is interfering with blood circulation. Question 29. Which statement is true about the effects of the aging process? Option A. The aging process can be reversed with good healthcare. Option B. Bladder incontinence is a normal part of aging. Option C. Joints tend to be less flexible as a person ages. Option D. Sensitivity to pain increases with age. The correct answer is option C. Joints tend to be less flexible as a person ages. Aging involves physiological changes including stiffer joints and a decrease in skin elasticity. Question 30. A resident is in restraints. What observation should be reported to the nurse immediately? Option A. The resident states that they do not like the device. Option B. The resident's position needs to be adjusted. Option C. The resident has suddenly become very agitated. Option D. The restraint was removed according to the schedule. The correct answer is option C. The resident has suddenly become very agitated. Sudden agitation in a restrained resident can lead to injury, strangulation, or increased physical stress. Question 31. While feeding a resident, you notice they are coughing a lot after each drink. What is the appropriate response? Option A. Allow the resident more time to swallow. Option B. Use a straw when giving the resident fluids. Option C. Add a thickening product to the fluids. Option D. Stop the feeding and ask a nurse to check the resident. The correct answer is option D. Stop the feeding and ask a nurse to check the resident. Persistent coughing is a primary sign of aspiration, which can lead to life-threatening pneumonia. Question 32. A resident has had only 50 milliliters of urine output in the last 6 hours. What should you do first? Option A. Begin offering the resident fluids every 15 minutes. Option B. Report the observation to the charge nurse immediately. Option C. Ask if the resident has pain when urinating. Option D. Check to see if the tubing is kinked or bent. The correct answer is option D. Check to see if the tubing is kinked or bent. Low output in a catheterized resident is often caused by a simple mechanical blockage in the tubing. Question 33. When caring for a comatose resident, the nursing assistant is expected to do what? Option A. Provide mouth care once a day. Option B. Avoid changing the resident's position. Option C. Talk to the resident while providing care. Option D. Keep the resident's room dark and quiet. The correct answer is option C. Talk to the resident while providing care. It is often believed that hearing is the last sense to leave. Talking to the resident provides comfort and dignity. Question 34. When a resident is not able to stand, how is their height usually measured? Option A. Having coworkers hold the resident upright. Option B. Adding the length of legs, chest, and head. Option C. Asking the resident and subtracting an inch for age. Option D. Taking the measurement from head to heels while they are flat in bed. The correct answer is option D. Taking the measurement from head to heels while they are flat in bed. Measuring the resident while they are in a supine position ensures an accurate height for non-ambulatory patients. Question 35. A resident at the dining table begins to have a seizure. What should the assistant do next? Option A. Guide the resident from the chair to the floor. Option B. Remove the other residents away from the table. Option C. Try to open the resident's mouth to check for food. Option D. Keep the resident in the chair by holding their waist. The correct answer is option A. Guide the resident from the chair to the floor. Moving the resident to the floor prevents them from falling out of the chair and provides a safe space for the seizure to occur. Question 36. A resident says their food is poisoned and refuses to eat. What is the best response? Option A. Offer to taste all the food first. Option B. Report to the nurse that the resident is acting crazy. Option C. Ask if there is something else the resident would like to eat. Option D. Leave the resident alone because they will eat when hungry. The correct answer is option C. Ask if there is something else the resident would like to eat. Offering an alternative food item helps ensure the resident receives nutrition while respecting their current state of mind. Question 37. Which of the following is an example of the process of disinfection? Option A. Washing a resident's hands after toileting. Option B. Using a wipe to clean around a resident's stoma. Option C. Cleaning a shower chair with a chemical cleanser. Option D. Cleaning a resident's bath basin with soap after use. The correct answer is option C, cleaning a shower chair with a chemical cleanser. Disinfection involves using specialized chemicals to kill most microorganisms on equipment and surfaces. Question 38. Which of the following is a protected right of nursing home residents? Option A, to select the specific staff that will provide their care. Option B, to have designated smoking areas in the facility. Option C, to make decisions about their care and treatment. Option D, to have activities offered on every single shift. The correct answer is option C, to make decisions about their care and treatment. Autonomy in medical and personal decision-making is a core component of the resident's Bill of Rights. Question 39. After reporting a red area on a resident's hip, the nursing assistant should expect what? Option A, the resident will be placed on short-term bed rest. Option B, the area will be covered with a protective dressing. Option C, the area will need frequent massage with lotion. Option D, the resident should be positioned to avoid pressure on the area. The correct answer is option D, the resident should be positioned to avoid pressure on the area. Keeping weight off a reddened area is the most effective way to prevent a stage 1 pressure injury from worsening. Question 40. It is most important for the nursing assistant to check water temperature before doing what? Option A, assisting the resident with mouth care. Option B, soaking the resident's feet for foot care. Option C, giving the resident a bed bath. Option D, washing their own hands. The correct answer is option B, soaking the resident's feet for foot care. Soaking involves prolonged contact with water. Checking the temperature prevents thermal injury to the skin. Question 41. A resident has pain in the arms and jaw and is sweating. What should you do? Option A, check the arms and jaw for possible injury. Option B, check the care plan to see if they are on heart precautions. Option C, ask if they ate something that upset their stomach. Option D, recognize the seriousness and report immediately. The correct answer is option D, recognize the seriousness and report immediately. Pain in the jaw and arms, along with sweating, are classic signs of a heart attack. Question 42. You notice a resident is eating very little of their lunch. What is the most important action? Option A, check if the resident was snacking before the meal. Option B, ask if the resident would like something else to eat. Option C, remind the resident that dinner is several hours away. Option D, check when the resident last had a bowel movement. The correct answer is option B, ask if the resident would like something else to eat. Identifying and offering preferred alternatives ensures the resident maintains adequate nutritional intake. Question 43. To help prevent confused residents from accidentally leaving the home, the facility may do what? Option A, block exit doors. Option B, restrain residents. Option C, place large stop signs on doors. Option D, keep confused residents in their rooms. The correct answer is option C, place large stop signs on doors. Visual cues like stop signs or disguised doors are safe ways to deter elopement without using physical restraints. Question 44. What is most important to observe when a resident wears elastic compression stockings? Option A, the resident's shoe fit. Option B, the resident's pulse rate. Option C, the way the resident walks. Option D, the color of the resident's toes. The correct answer is option D, the color of the resident's toes. Checking toe color allows the assistant to monitor for adequate blood circulation while the stockings are in place. Question 45. When cleaning, which area of the body is it most important to change the spot on the washcloth for each stroke? Option A, arms and hands. Option B, abdominal area. Option C, face and neck. Option D, perineal area. The correct answer is option D, perineal area. Changing the washcloth area during perineal care prevents the spread of bacteria from one area to another. Question 46. A resident is slow getting dressed and misses her friends at breakfast. What should you do? Option A, set out clothing that they can dress in more quickly. Option B, dress the resident yourself to make it faster. Option C, ask if there is any help the resident would like in the morning. Option D, remind the resident that friends will be at activities later. The correct answer is option C, ask if there is any help the resident would like in the morning. Assisting the resident based on their preference helps them meet their social goals while maintaining independence. Question 47. A trash can in a resident's room is on fire. What should the nursing assistant do first? Option A. Use the resident's pitcher of water to put out the fire. Option B. Open the window to get the smoke out of the room. Option C. Yell fire along with the room number. Option D. Remove the resident from the room. The correct answer is option D. Remove the resident from the room. Removing the person from immediate danger is the first and most critical step of any fire response plan. Question 48. A resident with a feeding tube is scheduled for a shower. What is the appropriate response? Option A. Disconnect the feeding tube temporarily to give the shower. Option B. Protect the pump with a plastic bag. Option C. Ask the charge nurse for assistance with the pump. Option D. Give the resident a bed bath instead. The correct answer is option C. Ask the charge nurse for assistance with the pump. A nursing assistant is not authorized to manipulate feeding pumps, the nurse must manage the equipment. Question 49. What is the normal medical appearance of healthy urine? Option A. Clear. Option B. Cloudy. Option C. Dark yellow. Option D. Strong smelling. The correct answer is option A. Clear. Healthy urine should be clear and pale yellow. Cloudiness or strong odors can indicate an infection. Question 50. A resident with a history of falls is found on the floor and is crying. What do you do first? Option A. Call for help while keeping the resident calm. Option B. Check for injuries while asking how they fell. Option C. Place a pillow under the head and cover with a blanket. Option D. Consider if the resident is trying to get attention. The correct answer is option A. Call for help while keeping the resident calm. Emergency protocols require calling for help immediately to ensure a professional assessment is performed. Question 51. A resident's hands shake while drinking, causing spills. What is the best response? Option A. Thicken the liquid so it will not spill. Option B. Place a clothing protector on the resident. Option C. Seat the resident with others who also spill. Option D. Suggest that the resident might do well with a cup with a lid. The correct answer is option D. Suggest that the resident might do well with a cup with a lid. Adaptive devices like cups with lids support independence while minimizing messes and embarrassment. Question 52. True or false? A nursing assistant should never exercise a joint past the point of pain. Option A. True. Option B. False. The correct answer is option A. True. Passive range of motion should always stop at the first sign of resistance or resident discomfort. Question 53. True or false? Hand washing should be performed for at least 20 seconds. Option A. True. Option B. False. The correct answer is option A. True. 20 seconds of scrubbing is necessary to mechanically remove pathogens from the surface of the skin. Question 54. True or false? You should use hot water when cleaning a resident's dentures. Option A. True. Option B. False. The correct answer is option B. False. Hot water can warp the plastic material of dentures. Lukewarm or cool water should always be used. Question 55. True or false? A nursing assistant can legally give a resident their daily medications. Option A. True. Option B. False. The correct answer is option B. False. Medication administration is restricted to licensed nurses or certified medication technicians. Question 56. True or false? Incontinence is a normal and expected part of the aging process. Option A. True. Option B. False. The correct answer is option B. False. While more common in the elderly, incontinence is not a normal part of aging and often has treatable causes. Question 57. True or false? You should always knock before entering a resident's room. Option A. True. Option B. False. The correct answer is option A. True. Knocking is a sign of respect for the resident's privacy and their personal living space. Question 58. True or false? A gait belt should be applied over the resident's clothing. Option A. True. Option B. False. The correct answer is option A. True. Applying a gait belt over clothing prevents skin irritation and shearing during transfers. Question 59. True or false? It is acceptable to share a resident's medical status with their best friend. Option A. True. Option B. False. The correct answer is option B. False. Privacy laws forbid sharing medical information with anyone not on the healthcare team without the resident's consent. Question 60. True or false, a resident has the right to refuse a bath? Option A, true. Option B, false. The correct answer is option A, true. The right to refuse care is a fundamental part of the resident's Bill of Rights. Question 61. True or false, when shaving a resident, you should shave in the opposite direction of hair growth? Option A, true. Option B, false. The correct answer is option B, false. Shaving in the direction of hair growth prevents skin irritation, nicks, and ingrown hairs. Question 62. True or false, mouth care for an unconscious resident should be done every 2 hours? Option A, true. Option B, false. The correct answer is option A, true. Frequent care is necessary to prevent infection and keep the oral mucosa from drying out and cracking. Question 63. True or false, a Foley catheter bag should be hung on the bed rail? Option A, true. Option B, false. The correct answer is option B, false. The bag must be hung on the bed frame, as moving side rails can pull on the catheter and cause injury. Question 64. True or false, standard precautions should be used for all residents regardless of their diagnosis? Option A, true. Option B, false. The correct answer is option A, true. Standard precautions assume all body fluids are potentially infectious and protect both staff and residents. Question 65. True or false, a nursing assistant is responsible for providing emotional support to the resident? Option A, true. Option B, false. The correct answer is option A, true. Psychosocial care is a core duty of the nursing assistant to ensure the whole person is cared for. Question 66. True or false, you should use a paper towel to turn off the water faucet after washing your hands? Option A, true. Option B, false. The correct answer is option A, true. Using a dry paper towel prevents your clean hands from picking up germs from the dirty faucet handle. Question 67. True or false, chronic illness refers to a sudden illness from which the person is expected to recover? Option A, true. Option B, false. The correct answer is option B, false. An ongoing, long-term illness with no known cure is defined as a chronic illness. Question 68. True or false, the rectum is the most accurate site for taking a temperature? Option A, true. Option B, false. The correct answer is option A, true. Rectal temperatures are closest to the body's actual core temperature. Question 69. True or false, you should never put anything in the mouth of a person having a seizure? Option A, true. Option B, false. The correct answer is option A, true. Placing items in the mouth can cause broken teeth, choking, or injury to the caregiver. Question 70. True or false, when a resident is in a wheelchair, the drainage bag should be placed on the floor? Option A, true. Option B, false. The correct answer is option B, false. The bag should be attached to the chair frame and kept off the floor to prevent contamination. Question 71. True or false, a nursing assistant may cut the toenails of a diabetic resident? Option A, true. Option B, false. The correct answer is option B, false. Due to high infection risks, nail care for diabetic residents is usually performed by a nurse or podiatrist. Question 72. True or false, a nursing assistant should report if a resident has not had a bowel movement for 3 days? Option A, true. Option B, false. The correct answer is option A, true. Monitoring elimination patterns is critical for preventing complications like fecal impaction. Question 73. True or false, it is acceptable to talk about a resident's behavior in the staff break room? Option A, true. Option B, false. The correct answer is option B, false. Discussing resident details in public or non-clinical areas is a violation of HIPAA privacy laws. Question 74. True or false, the last sense a dying person usually loses is the sense of hearing? Option A, true. Option B, false. The correct answer is option A, true. It is believed that hearing persists even after a person has become unresponsive during the dying process. Question 75. True or false, you should always use a draw sheet to move a resident up in bed. Option A, true. Option B, false. The correct answer is option A, true. A draw sheet helps lift the resident and prevents skin shearing caused by sliding. Question 76. True or false, hypertension is the medical term for low blood pressure. Option A, true. Option B, false. The correct answer is option B, false. Hypertension refers to high blood pressure, hypotension refers to low blood pressure. Question 77. True or false, when dressing a resident with a weak side, you should dress the weak side first. Option A, true. Option B, false. The correct answer is option A, true. Dressing the weak side first makes it easier to position the garment over the limb with limited movement. Question 78. True or false, it is okay to accept a small cash tip from a resident's family. Option A, true. Option B, false. The correct answer is option B, false. Professional ethics and facility policies strictly prohibit the acceptance of tips or gifts. Question 79. True or false, a nursing assistant should always call a resident by their first name. Option A, true. Option B, false. The correct answer is option B, false. Always use the resident's preferred name and title, such as Mr. or Mrs., to show respect. Question 80. True or false, you must always wear a mask when entering a room under droplet precautions. Option A, true. Option B, false. The correct answer is option A, true. Masks prevent the inhalation of large respiratory droplets that carry infectious pathogens. Question 81. True or false, an incident report should be filled out if you find a resident on the floor. Option A, true. Option B, false. The correct answer is option A, true. Any unplanned event that results in potential or actual harm must be documented in an incident report. Question 82. True or false, a resident with a do not resuscitate order should still receive comfort care. Option A, true. Option B, false. The correct answer is option A, true. A do not resuscitate order only applies to CPR, all other medical and comfort care should continue. Question 83. True or false, you should record fluid intake in the unit of ounces. Option A, true. Option B, false. The correct answer is option B, false. Fluid intake should always be documented in milliliters for medical consistency. Question 84. True or false, range of motion exercises help to prevent contractures. Option A, true. Option B, false. The correct answer is option A, true. Regularly moving joints through their full range keeps muscles and tendons from shortening. Question 85. True or false, you should use a padded tongue blade during mouth care for an unconscious resident. Option A, true. Option B, false. The correct answer is option A, true. A tongue blade or mouth swab helps keep the mouth open safely while you clean the oral tissues. Question 86. True or false, perineal care should be performed from back to front. Option A, true. Option B, false. The correct answer is option B, false. Always wash from front to back to avoid dragging bacteria from the rectum into the urinary tract. Question 87. True or false, a nursing assistant should report if a resident's pulse is 120 beats per minute. Option A, true. Option B, false. The correct answer is option A, true. A pulse of 120 is considered tachycardia and should be assessed by a nurse. Question 88. True or false, you should use lukewarm water for a sitz bath. Option A, true. Option B, false. The correct answer is option B, false. A sitz bath typically uses warm to hot water, around 105 degrees, to promote healing. Question 89. True or false, the acronym PASS is used for operating a fire extinguisher. Option A, true. Option B, false. The correct answer is option A, true. PASS stands for pull the pin, aim at the base, squeeze the handle, and sweep from side to side. Question 90. True or false, a nursing assistant can tell a resident's family their medical diagnosis. Option A, true. Option B, false. The correct answer is option B, false. Only the nurse or doctor is authorized to discuss diagnoses and treatment plans with families. Question 91. True or false, a resident who is NPO is allowed to have ice chips? Option A, true. Option B, false. The correct answer is option B, false. Nothing by mouth means no food or fluids are allowed, including ice chips, unless specifically ordered. Question 92. True or false, it is necessary to wear gloves when providing a back massage? Option A, true. Option B, false. The correct answer is option B, false. Gloves are not required for a back massage unless the resident has broken skin or a contagious condition. Question 93. True or false, bed rails are always considered a form of restraint? Option A, true. Option B, false. The correct answer is option B, false. Bed rails are only a restraint if they prevent the resident from voluntarily getting out of bed. Question 94. True or false, you should always use two people when log rolling a resident? Option A, true. Option B, false. The correct answer is option A, true. Two people are required to safely maintain the alignment of the resident's spine during the roll. Question 95. True or false, cyanosis refers to a yellow discoloration of the skin? Option A, true. Option B, false. The correct answer is option B, false. Cyanosis is a blue or gray discoloration caused by a lack of oxygen in the blood. Question 96. True or false, a nursing assistant should empty a resident's catheter bag at the end of every shift? Option A, true. Option B, false. The correct answer is option A, true. Regularly emptying the bag prevents it from becoming too heavy and allows for accurate intake and output tracking. Question 97. True or false, you should always check for a resident's dentures before they eat? Option A, true. Option B, false. The correct answer is option A, true. Properly fitted dentures are necessary for effective chewing and preventing choking. Question 98. True or false, a nursing assistant should never ignore a resident's call light? Option A, true. Option B, false. The correct answer is option A, true. Promptly answering call lights ensures resident safety and meets their immediate needs. Question 99. True or false, semi-Fowler's position is an elevation of 30 to 45 degrees? Option A, true. Option B, false. The correct answer is option A, true. This position is commonly used to help residents breathe more easily and rest comfortably. Question 100. True or false, you should report if a resident's blood pressure is 90/60? Option A, true. Option B, false. The correct answer is option A, true. This is the lower limit of normal blood pressure and may indicate hypotension in some residents. Question 101. True or false, a nursing assistant should follow the facility's chain of command? Option A, true. Option B, false. The correct answer is option A, true. Following the chain of command ensures that information and concerns are handled by the correct supervisor. Question 102. What is the definition of an acute illness? Option A. An ongoing illness with no known cure. Option B. A sudden illness from which the person is expected to recover. Option C. A slow and gradual loss of body function. Option D. A permanent disability caused by injury. The correct answer is option B. A sudden illness from which the person is expected to recover. Acute illnesses are characterized by a rapid onset and short duration, with the expectation of recovery. Question 103. Which term describes an ongoing illness that is slow or gradual in onset and has no known cure? Option A, acute illness. Option B, terminal illness. Option C, chronic illness. Option D, infectious illness. The correct answer is option C, chronic illness. Chronic illnesses like arthritis or heart disease require long-term management rather than a quick cure. Question 104. A terminal illness is best described as which of the following? Option A. An illness that results in a full recovery. Option B. An illness that lasts for at least 6 months. Option C. An illness that will result in death. Option D. An illness that only affects the elderly. The correct answer is option C. An illness that will result in death. Terminal illnesses are those for which there is no effective treatment and death is the expected outcome. Question 105. What does the abbreviation ALR stand for in a healthcare setting? Option A, Advanced Life Resuscitation. Option B, Assisted Living Residence. Option C, Ambulatory Leg Rotation. Option D, Acute Liver Recovery. The correct answer is option B, Assisted Living Residence. An assisted living residence provides housing and support for individuals who need help with daily tasks but not full nursing care. Question 106. Who is the Director of Nursing in a long-term care facility? Option A, the person who manages the facility's budget. Option B, the physician who oversees all medical treatments. Option C, the registered nurse responsible for the entire nursing staff. Option D, the person in charge of resident activities. The correct answer is option C, the registered nurse responsible for the entire nursing staff. The Director of Nursing is the highest-ranking administrative nurse who oversees all clinical operations. Question 107. What is the definition of a skilled nursing facility? Option A, a place where residents do their own cooking and cleaning. Option B, a facility that provides 24-hour nursing care and rehabilitation. Option C, a community for independent seniors. Option D, a hospital unit specifically for surgery. The correct answer is option B, a facility that provides 24-hour nursing care and rehabilitation. Skilled nursing facilities provide high-level medical care and therapy for residents with complex needs. Question 108. If a resident is described as alert and oriented ×4, they are aware of what? Option A, self and place. Option B, self, place, and date. Option C, self, place, date, and time. Option D, self, place, date, time, and current events. The correct answer is option D, self, place, date, time, and current events. This level of orientation indicates a high level of cognitive function across all major categories. Question 109. What is the purpose of respite care? Option A, to provide permanent housing for the elderly. Option B, to give a short-term break to a caregiver who looks after a person at home. Option C, to provide emergency surgery for trauma victims. Option D, to offer spiritual counseling to dying residents. The correct answer is option B, to give a short-term break to a caregiver who looks after a person at home. Respite care allows family caregivers to take time off while their loved one is safely cared for in a facility. Question 110. Which healthcare professional focuses on helping a resident restore physical function? Option A, occupational therapist. Option B, physical therapist. Option C, speech-language pathologist. Option D, social worker. The correct answer is option B, physical therapist. Physical therapists specialize in improving mobility, strength, and balance after an injury or illness. Question 111. Which healthcare professional helps a resident return to their activities of daily living? Option A, physical therapist. Option B, social worker. Option C, occupational therapist. Option D, registered dietitian. The correct answer is option C, occupational therapist. Occupational therapists help residents adapt to their environment and relearn tasks like dressing and eating. Question 112. What is the difference between Medicare and Medicaid? Option A, Medicare is for the poor and Medicaid is for the elderly. Option B, Medicare is a state program and Medicaid is a federal program. Option C, Medicare is federal insurance for those over 65 and Medicaid is for low-income individuals. Option D, there is no difference between the two programs. The correct answer is option C. Medicare is federal insurance for those over 65 and Medicaid is for low-income individuals. Medicare is an age-based federal program, while Medicaid is a state and federal partnership based on financial need. Question 113. What is the primary role of an ombudsman? Option A, to manage the facility's nursing schedule. Option B, to help residents voice grievances and protect their rights. Option C, to prescribe medications to residents. Option D, to perform physical therapy on the residents. The correct answer is option B, to help residents voice grievances and protect their rights. The ombudsman is an independent advocate who investigates complaints and ensures residents are treated fairly. Question 114. Who must provide a legal order before a resident can be placed in restraints? Option A. The Director of Nursing. Option B. The resident's family. Option C. The doctor. Option D. The nursing assistant. The correct answer is option C. The doctor. Restraints are a medical intervention that requires a specific physician's order and medical justification. Question 115. The term ethics is best defined as which of the following? Option A. The legal laws governing a state. Option B. The knowledge of what is right and wrong. Option C. The facility's policy on vacation time. Option D. The religious beliefs of the nursing staff. The correct answer is option B. The knowledge of what is right and wrong. Ethics involve the moral principles that guide professional behavior and decision-making. Question 116. What is the definition of malpractice? Option A. Negligence by a professional person like a doctor or nurse. Option B. Unintentional harm caused by a nursing assistant. Option C. Making false statements about a coworker. Option D. Stealing property from a resident. The correct answer is option A. Negligence by a professional person like a doctor or nurse. Malpractice is a specific legal term for negligence committed by a licensed professional. Question 117. Neglect is defined as which of the following? Option A. Touching a person without their consent. Option B. The failure to provide services to prevent mental or physical harm. Option C. Threatening to harm a resident. Option D. Entering a resident's room without knocking. The correct answer is option B. The failure to provide services to prevent mental or physical harm. Neglect occurs when a caregiver fails to provide necessary care, leading to potential injury or distress. Question 118. What is the clinical difference between slander and libel? Option A. Slander is written and libel is oral. Option B. Slander is oral and libel is written. Option C. Slander is intentional and libel is accidental. Option D. There is no difference between the two. The correct answer is option B. Slander is oral and libel is written. Both are forms of defamation, but slander is spoken while libel is recorded in writing or images. Question 119. Assault is defined as which of the following? Option A. Touching a person without their consent. Option B. Threatening to harm someone without their consent. Option C. Making false statements about a resident. Option D. Ignoring a resident's call light. The correct answer is option B. Threatening to harm someone without their consent. Assault is the threat of harm that makes a person fear for their safety, even if no contact is made. Question 120. Battery is defined as which of the following? Option A. Threatening to hit a resident. Option B. Touching a person's body without his or her consent. Option C. Stealing money from a resident's nightstand. Option D. Failing to turn a resident every 2 hours. The correct answer is option B. Touching a person's body without his or her consent. Battery is the actual physical act of touching or harming someone without their permission. Question 121. The concept of holism in nursing care means what? Option A. Only treating the physical symptoms of a disease. Option B. Focusing on the spiritual needs of the resident only. Option C. Considering the whole person including physical, social, and psychological needs. Option D. Treating all residents in the facility exactly the same. The correct answer is option C. Considering the whole person including physical, social, and psychological needs. Holistic care acknowledges that emotional and social health are just as important as physical health. Question 122. A person who is comatose is described as being in what state? Option A. Alert but unable to speak. Option B. Unable to respond to stimuli. Option C. Confused about their identity. Option D. Paralyzed on one side of the body. The correct answer is option B. Unable to respond to stimuli. A comatose state is a deep level of unconsciousness where the brain does not respond to the environment. Question 123. In Maslow's hierarchy of needs, which of the following is considered a safety and security need? Option A. Having a sense of self-worth. Option B. Feeling loved by family members. Option C. Knowing what to expect and feeling protected from harm. Option D. Having enough food and water to survive. The correct answer is option C. Knowing what to expect and feeling protected from harm. Safety needs are the second level of the hierarchy and include stability and protection from danger. Question 124. Which communication technique involves repeating the person's message in your own words? Option A. Focusing. Option B. Clarifying. Option C. Paraphrasing. Option D. Open-ended questioning. The correct answer is option C. Paraphrasing. Paraphrasing helps the assistant confirm they have correctly understood the resident's meaning. Question 125. Bariatrics is the branch of medicine that deals with which of the following? Option A. The care of the elderly. Option B. The treatment of obesity. Option C. The study of the nervous system. Option D. The care of newborn infants. The correct answer is option B. The treatment of obesity. Bariatric care involves specialized equipment and techniques for residents with very high body mass. Question 126. What is the definition of homeostasis? Option A. The process of human reproduction. Option B. The ability of the body to maintain a stable internal environment. Option C. The process of a disease spreading through the body. Option D. The breakdown of muscle tissue due to lack of use. The correct answer is option B. The ability of the body to maintain a stable internal environment. Homeostasis ensures that vital functions like temperature and fluid balance stay within a normal range. Question 127. Which type of tissue covers the internal and external surfaces of the body? Option A. Connective tissue. Option B. Muscle tissue. Option C. Nerve tissue. Option D. Epithelial tissue. The correct answer is option D. Epithelial tissue. Epithelial tissue forms the skin and the linings of the internal organs. Question 128. Which type of tissue connects, supports, and surrounds other tissues and organs? Option A. Nerve tissue. Option B. Muscle tissue. Option C. Connective tissue. Option D. Epithelial tissue. The correct answer is option C. Connective tissue. Connective tissue includes things like bone, cartilage, and adipose or fat tissue. Question 129. What is the outer layer of the skin called? Option A. The dermis. Option B. The subcutaneous layer. Option C. The epidermis. Option D. The hair root. The correct answer is option C. The epidermis. The epidermis is the protective top layer of skin that we can see. Question 130. The inner layer of the skin which contains blood vessels and nerves is called what? Option A. The epidermis. Option B. The dermis. Option C. The skeletal layer. Option D. The epithelial layer. The correct answer is option B. The dermis. The dermis is located beneath the epidermis and houses sweat glands and hair follicles. Question 131. What is a primary function of the sweat glands? Option A. To produce oil for the skin. Option B. To help regulate body temperature. Option C. To grow hair roots. Option D. To produce red blood cells. The correct answer is option B. To help regulate body temperature. Evaporation of sweat from the skin surface helps cool the body down when it is overheated. Question 132. How many bones are in the adult human body? Option A. 105. Option B. 206. Option C. 312. Option D. 500. The correct answer is option B. 206. The adult skeleton is composed of 206 bones that provide structure and protection. Question 133. Which type of bone is the femur? Option A. Flat bone. Option B. Short bone. Option C. Irregular bone. Option D. Long bone. The correct answer is option D. Long bone. Long bones are typically found in the limbs and are longer than they are wide. Question 134. What is the name of the membrane that covers the bones? Option A. The periosteum. Option B. The synovial membrane. Option C. The cartilage. Option D. The dermis. The correct answer is option A. The periosteum. The periosteum is a dense layer of vascular connective tissue enveloping the bones. Question 135. Where are red blood cells formed in the body? Option A. In the heart. Option B. In the liver. Option C. In the bone marrow. Option D. In the spleen. The correct answer is option C. In the bone marrow. The soft tissue inside the center of bones is responsible for producing new blood cells. Question 136. What type of joint is the hip? Option A. Hinge joint. Option B. Pivot joint. Option C. Ball and socket joint. Option D. Fixed joint. The correct answer is option C. Ball and socket joint. Ball and socket joints allow for the widest range of movement in multiple directions. Question 137. What happens to blood vessels when the body is cold? Option A. They dilate to increase blood flow. Option B. They constrict to maintain core heat. Option C. They disappear into the muscle tissue. Option D. They stop carrying oxygen. The correct answer is option B. They constrict to maintain core heat. Vasoconstriction helps prevent heat loss through the skin when the environment is cold. Question 138. What is the medical term for red blood cells? Option A. Leukocytes. Option B. Platelets. Option C. Erythrocytes. Option D. Plasma. The correct answer is option C. Erythrocytes. Erythrocytes are responsible for carrying oxygen from the lungs to the body tissues. Question 139. What is the medical term for white blood cells? Option A. Erythrocytes. Option B. Leukocytes. Option C. Platelets. Option D. Lymphocytes. The correct answer is option B. Leukocytes. Leukocytes are the primary cells of the immune system that fight infections. Question 140. Which component of the blood is needed for blood clotting? Option A. Plasma. Option B. Red blood cells. Option C. White blood cells. Option D. Platelets. The correct answer is option D. Platelets. Platelets clump together to form plugs that stop bleeding from damaged blood vessels. Question 141. Which chamber of the heart receives oxygenated blood from the lungs? Option A. Right atrium. Option B. Left atrium. Option C. Right ventricle. Option D. Left ventricle. The correct answer is option B. Left atrium. The left atrium is the entry point for blood that has just been enriched with oxygen in the lungs. Question 142. Which chamber of the heart pumps oxygenated blood to all parts of the body? Option A. Right atrium. Option B. Left atrium. Option C. Right ventricle. Option D. Left ventricle. The correct answer is option D. Left ventricle. The left ventricle is the most muscular chamber because it must pump blood through the entire systemic circulation. Question 143. What is the primary difference between arteries and veins? Option A. Arteries carry blood to the heart and veins carry it away. Option B. Arteries carry blood away from the heart and veins carry it to the heart. Option C. Arteries are only in the legs and veins are only in the arms. Option D. There is no clinical difference between the two. The correct answer is option B. Arteries carry blood away from the heart and veins carry it to the heart. Arteries generally carry oxygen-rich blood, while veins carry oxygen-poor blood back to the heart. Question 144. What connects muscles to bones? Option A. Ligaments. Option B. Cartilage. Option C. Tendons. Option D. Fascia. The correct answer is option C. Tendons. Tendons are tough bands of fibrous connective tissue that transmit the force of muscle contraction to the bone. Question 145. What connects bones to other bones at a joint? Option A. Tendons. Option B. Ligaments. Option C. Muscle fibers. Option D. Skin. The correct answer is option B. Ligaments. Ligaments provide stability to joints and prevent excessive or abnormal movement. Question 146. The central nervous system consists of which two parts? Option A. The brain and the cranial nerves. Option B. The spinal cord and the peripheral nerves. Option C. The brain and the spinal cord. Option D. The sympathetic and parasympathetic nerves. The correct answer is option C. The brain and the spinal cord. The brain and spinal cord process information and control the body's responses. Question 147. Which part of the brain is the largest and controls reasoning and memory? Option A. The cerebellum. Option B. The brainstem. Option C. the cerebrum. Option D, the medulla. The correct answer is option C, the cerebrum. The cerebrum is divided into two hemispheres and manages complex cognitive functions. Question 148. Which part of the brain regulates and coordinates body movements? Option A, the cerebrum. Option B, the brainstem. Option C, the cerebellum. Option D, the pons. The correct answer is option C, the cerebellum. The cerebellum ensures that muscle movements are smooth and balanced. Question 149. What does the medulla control in the human body? Option A, reasoning and logic. Option B, heart rate, breathing, and swallowing. Option C, vision and hearing. Option D, balance and posture. The correct answer is option B, heart rate, breathing, and swallowing. The medulla oblongata is part of the brainstem and manages vital and voluntary functions. Question 150. In the event of a fire, what does the acronym RACE stand for? Option A, run, alarm, call, exit. Option B, rescue, alarm, confine, extinguish. Option C, rescue, activate, clear, evacuate. Option D, remove, alarm, contain, extinguish. The correct answer is option B, rescue, alarm, confine, extinguish. This standardized procedure ensures that life safety is prioritized before property protection. Question 151. When using a fire extinguisher, what does the acronym PASS stand for? Option A, pull, aim, squeeze, sweep. Option B, push, aim, shake, spray. Option C, pull, activate, squeeze, siphon. Option D, point, aim, squeeze, separate. The correct answer is option A, pull, aim, squeeze, sweep. These four steps describe the correct mechanical operation of a portable fire extinguisher. Question 152. What is a chemical restraint? Option A, a spray used to clean a residence room. Option B, a drug used for discipline or convenience that is not required for medical treatment. Option C, a cleaning agent used in the laundry. Option D, a medication used to treat a specific infection. The correct answer is option B, a drug used for discipline or convenience that is not required for medical treatment. Using medication to restrict a resident's movement or behavior without a medical need is illegal. Question 153. How often must a resident in physical restraints be released? Option A, once every hour. Option B, every 2 hours. Option C, once per shift. Option D, only when they need to use the bathroom. The correct answer is option B, every 2 hours. Regular release is required to check skin integrity, provide range of motion, and offer toileting. Question 154. What is the single most effective way to prevent the spread of infection? Option A, wearing a mask at all times. Option B, using double gloves. Option C, washing your hands. Option D, keeping all residents in their rooms. The correct answer is option C, washing your hands. Hand hygiene is the foundation of infection control in all healthcare settings. Question 155. Standard precautions are used for which group of residents? Option A, only residents with known infections. Option B, only residents in the intensive care unit. Option C, all residents whenever providing care. Option D, only residents who are coughing. The correct answer is option C, all residents whenever providing care. Standard precautions assume that all blood and body fluids are potentially infectious. Question 156. What is the correct order to put on personal protective equipment? Option A, gloves, gown, mask, goggles. Option B, gown, mask, goggles, gloves. Option C, mask, goggles, gown, gloves. Option D, gloves, goggles, mask, gown. The correct answer is option B, gown, mask, goggles, gloves. Putting the gown on first and gloves on last ensures maximum coverage and protection. Question 157. What is the correct order to remove personal protective equipment? Option A, gloves, goggles, mask, gown. Option B, gown, mask, goggles, gloves. Option C, mask, goggles, gown, gloves. Option D, goggles, gloves, gown, mask. The correct answer is option A, gloves, goggles, mask, gown. Removing gloves first prevents the contamination of the rest of the removal process. Question 158. What is the definition of Fowler's position? Option A. The bed is flat. Option B. The head of the bed is elevated to 45 to 60 degrees. Option C. The head of the bed is elevated to 30 degrees. Option D. The resident is lying on their stomach. The correct answer is option B. The head of the bed is elevated to 45 to 60 degrees. Fowler's position is used to facilitate breathing and for residents during mealtimes. Question 159. Semi-Fowler's position involves elevating the head of the bed to how many degrees? Option A, 15 to 20 degrees. Option B, 30 to 45 degrees. Option C, 60 to 90 degrees. Option D, 0 degrees. The correct answer is option B, 30 to 45 degrees. This lower angle is often used for resting or for residents with certain cardiac conditions. Question 160. Where are the strongest muscles in the human body located for lifting? Option A. In the back and neck. Option B. In the forearms and wrists. Option C. In the shoulders, upper arms, hips, and thighs. Option D. In the calves and ankles. The correct answer is option C. In the shoulders, upper arms, hips, and thighs. Using these large muscle groups helps protect the smaller, more fragile muscles of the spine from injury. Question 161. How often should residents who are confined to bed be repositioned? Option A. Once every 4 hours. Option B. Every 2 hours. Option C. Once per shift. Option D. Only when they ask to be moved. The correct answer is option B. Every 2 hours. Frequent repositioning is the primary way to prevent the development of pressure injuries. Question 162. What is the clinical definition of hematuria? Option A. Sugar in the urine. Option B. Protein in the urine. Option C. Blood in the urine. Option D. Bacteria in the urine. The correct answer is option C. Blood in the urine. Hematuria can indicate infection, injury, or other serious medical conditions in the urinary tract. Question 163. What does the term dysuria mean? Option A. Painful or difficult urination. Option B. Frequent urination at night. Option C. Large amounts of urine. Option D. Scant or small amounts of urine. The correct answer is option A. Painful or difficult urination. Dysuria is a common symptom of a urinary tract infection. Question 164. What is the difference between polyuria and oliguria? Option A. Polyuria is scant urine and oliguria is large amounts. Option B. Polyuria is large amounts of urine and oliguria is scant amounts. Option C. Polyuria is bloody urine and oliguria is clear urine. Option D. There is no difference between the two terms. The correct answer is option B. Polyuria is large amounts of urine and oliguria is scant amounts. Polyuria often occurs in diabetes, while oliguria can signal kidney failure or dehydration. Question 165. What is the medical definition of dysphagia? Option A. Difficulty speaking. Option B. Difficulty swallowing. Option C. Inability to urinate. Option D. Painful digestion. The correct answer is option B. Difficulty swallowing. Dysphagia refers to a medical condition where swallowing is difficult or painful. Question 166. Which term describes the swelling of body tissues with water? Option A. Dehydration. Option B. Regurgitation. Option C. Dysphagia. Option D. Edema. The correct answer is option D. Edema. Edema is the medical term for fluid retention that causes swelling in body tissues. Question 167. Regurgitation is best defined as which of the following? Option A. The process of breathing out. Option B. The forward flow of blood through the heart. Option C. The backward flow of stomach contents into the mouth. Option D. The movement of fluid into the lungs. The correct answer is option C. The backward flow of stomach contents into the mouth. Regurgitation occurs when food or stomach acid travels back up the esophagus into the mouth. Question 168. Which nutrient provides the body with its primary source of energy and fiber? Option A. Proteins. Option B. Fats. Option C. Carbohydrates. Option D, vitamins. The correct answer is option C, carbohydrates. Carbohydrates are the main energy source for the body and provide necessary dietary fiber. Question 169. Which nutrient is primarily responsible for providing a concentrated source of energy? Option A, fats. Option B, minerals. Option C, proteins. Option D, water. The correct answer is option A, fats. Fats provide a dense source of energy and help the body absorb certain vitamins. Question 170. Which nutrient is essential for tissue growth and repair? Option A, carbohydrates. Option B, fats. Option C, protein. Option D, fiber. The correct answer is option C, protein. Proteins are the building blocks of the body and are necessary for maintaining and repairing tissues. Question 171. A clear liquid diet includes foods that are at body temperature and do what? Option A, leave large amounts of residue. Option B, are thick and creamy. Option C, leave small amounts of residue and are usually transparent. Option D, consist only of pureed meats. The correct answer is option C, leave small amounts of residue and are usually transparent. Clear liquid diets consist of transparent fluids that are easy to digest and leave minimal residue. Question 172. A full liquid diet consists of which of the following? Option A, only water and clear broth. Option B, foods that are liquid at room temperature or melt at body temperature. Option C, solid foods that have been blended. Option D, high fiber grains and vegetables. The correct answer is option B, foods that are liquid at room temperature or melt at body temperature. Full liquid diets include clear liquids plus items like milk, puddings, and strained soups. Question 173. Which statement best describes a pureed diet? Option A, foods that are served raw. Option B, foods that have a baby food consistency. Option C, foods that are high in spices and flavor. Option D, foods that consist only of clear liquids. The correct answer is option B, foods that have a baby food consistency. Pureed diets are for residents with chewing or swallowing issues and consist of smooth, blended foods. Question 174. A mechanical soft diet is designed for which of the following? Option A, residents who are nothing by mouth. Option B, residents who require high-calorie snacks. Option C, residents who need semi-solid foods that are easily digested. Option D, residents who can only consume clear liquids. The correct answer is option C, residents who need semi-solid foods that are easily digested. Mechanical soft diets feature foods that are easy to chew and swallow, such as ground meats. Question 175. A bland diet is characterized by which of the following? Option A, foods that are very spicy. Option B, foods that are served at very hot temperatures. Option C, foods that are non-irritating and served at moderate temperatures. Option D, foods that are high in fiber and seeds. The correct answer is option C, foods that are non-irritating and served at moderate temperatures. Bland diets avoid irritants like caffeine, spices, and high fiber to soothe the digestive tract. Question 176. When feeding a resident, how full should the spoon be? Option A, 1/3 full. Option B, half full. Option C, completely full. Option D, 2/3 full. The correct answer is option A, 1/3 full. Small portions on the spoon prevent choking and allow the resident to chew effectively. Question 177. What is a nasogastric tube? Option A, a tube placed through the abdomen into the stomach. Option B, a tube used to provide oxygen through the nose. Option C, a feeding tube inserted through the nose into the stomach. Option D, a tube used to drain urine from the bladder. The correct answer is option C, a feeding tube inserted through the nose into the stomach. Nasogastric tubes are used for short-term enteral nutrition through the nasal passage. Question 178. What is a gastrostomy tube? Option A, a tube inserted through the nose. Option B, a feeding tube inserted through a surgical opening in the stomach. Option C, a tube used for intravenous fluids. Option D, a tube used to monitor heart rate. The correct answer is option B, a feeding tube inserted through a surgical opening in the stomach. Gastrostomy tubes are used for long-term feeding through an opening in the abdominal wall. Question 179. In terms of thickened liquids, which is true about honey and nectar consistencies? Option A, honey is thinner than nectar. Option B, nectar is thicker than honey. Option C, honey is thicker and nectar is thinner. Option D, they are the same thickness. The correct answer is option C, honey is thicker and nectar is thinner. Liquid consistencies are graded to help prevent aspiration. Honey is thicker than nectar. Question 180. What is the average normal oral temperature for an adult? Option A, 97.6 degrees Fahrenheit. Option B, 98.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option B, 98.6 degrees Fahrenheit. The standard average temperature taken by mouth is 98.6 degrees. Question 181. What is the average normal rectal temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 100.6 degrees Fahrenheit. The correct answer is option C, 99.6 degrees Fahrenheit. Rectal temperatures are generally 1 degree higher than oral temperatures. Question 182. What is the average normal axillary temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option B, 97.6 degrees Fahrenheit. Axillary temperatures are generally 1 degree lower than oral temperatures. Question 183. What is the average normal tympanic temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 99.6 degrees Fahrenheit. Option C, 97.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option A, 98.6 degrees Fahrenheit. Tympanic or ear temperatures are usually the same as oral temperatures. Question 184. What is the average normal temporal temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option C, 99.6 degrees Fahrenheit. Temporal or forehead scans are generally similar to rectal temperatures. Question 185. What color is the tip of a rectal thermometer? Option A, blue. Option B, green. Option C, red. Option D, yellow. The correct answer is option C, red. Red coating is the universal standard to identify rectal thermometers to prevent cross-contamination. Question 186. What color is the tip of an oral thermometer? Option A, red. Option B, blue. Option C, green. Option D, white. The correct answer is option B, blue. Blue coating identifies thermometers intended for oral or axillary use. Question 187. How long should a digital or electronic rectal thermometer stay in place? Option A, until the instrument beeps. Option B, 5 minutes. Option C, 10 minutes. Option D, 2 minutes. The correct answer is option A, until the instrument beeps. Modern electronic thermometers signal with a beep when the maximum temperature is reached. Question 188. When should you avoid taking a rectal temperature because it might stimulate the vagus nerve? Option A, if the resident has a headache. Option B, if the resident has a heart condition. Option C, if the resident has a broken leg. Option D, if the resident is hungry. The correct answer is option B, if the resident has a heart condition. Vagal stimulation can cause a dangerous drop in heart rate in residents with cardiac issues. Question 189. What is the normal pulse rate range for a healthy adult? Option A, 40 to 60 beats per minute. Option B, 100 to 140 beats per minute. Option C, 60 to 100 beats per minute. Option D, 80 to 120 beats per minute. The correct answer is option C, 60 to 100 beats per minute. A resting heart rate between 60 and 100 is considered normal for an adult. Question 190. How long should you count a radial pulse if the rhythm is regular? Option A, 15 seconds. Option B, 30 seconds. Option C, 60 seconds. Option D, 10 seconds. The correct answer is option B, 30 seconds. Multiplying a 30-second count by 2 is an efficient way to get the heart rate if it is regular. Question 191. How long must you count a radial pulse if it is irregular? Option A, 30 seconds. Option B, 45 seconds. Option C, 60 seconds. Option D, 2 minutes. The correct answer is option C, 60 seconds. A full minute is required to accurately assess the rate and rhythm of an irregular pulse. Question 192. How long should you count an apical pulse using a stethoscope? Option A, 30 seconds. Option B, 45 seconds. Option C, 60 seconds. Option D, 10 seconds. The correct answer is option C, 60 seconds. Apical pulses must always be counted for 1 full minute for clinical accuracy. Question 193. What is the normal respiration range for a healthy adult? Option A, 8 to 12 breaths per minute. Option B, 20 to 30 breaths per minute. Option C, 12 to 20 breaths per minute. Option D, 15 to 25 breaths per minute. The correct answer is option C, 12 to 20 breaths per minute. Adults typically breathe between 12 and 20 times per minute at rest. Question 194. How long should you count respirations for the most accurate result? Option A, 15 seconds. Option B, 30 seconds. Option C, 60 seconds. Option D, 10 seconds. The correct answer is option C, 60 seconds. Counting for a full minute allows the nursing assistant to observe the rhythm and depth of breathing. Question 195. What is the normal range for systolic blood pressure in an adult? Option A, 60 to 80. Option B, 140 to 160. Option C, 90 to 120. Option D, 100 to 130. The correct answer is option C, 90 to 120. The systolic pressure, or top number, is normal when it is between 90 and 120. Question 196. What is the normal range for diastolic blood pressure in an adult? Option A, 90 to 120. Option B, 60 to 80. Option C, 40 to 60. Option D, 80 to 100. The correct answer is option B, 60 to 80. The diastolic pressure, or bottom number, is normal when it is between 60 and 80. Question 197. What is another name for a blood pressure cuff? Option A, stethoscope. Option B, thermometer. Option C, sphygmomanometer. Option D, pulse oximeter. The correct answer is option C, sphygmomanometer. The sphygmomanometer is the formal medical name for the blood pressure cuff. Question 198. When is the best time to weigh a resident to ensure accuracy? Option A, in the evening after dinner. Option B, in the morning before breakfast after voiding. Option C, directly after a large snack. Option D, in the middle of the afternoon. The correct answer is option B, in the morning before breakfast after voiding. Weight is most stable in the morning after the bladder is emptied and before food intake. Question 199. How many inches are in 4 feet? Option A, 40 inches. Option B, 48 inches. Option C, 52 inches. Option D, 60 inches. The correct answer is option B, 48 inches. There are 12 inches per foot, so 4 feet equals 48 inches. Question 200. How many inches are in 5 feet? Option A, 50 inches. Option B, 60 inches. Option C, 70 inches. Option D, 80 inches. The correct answer is option B, 60 inches. Multiplying 5 feet by 12 inches equals 60 inches. Question 201. How many inches are in 6 feet? Option A, 66 inches. Option B, 72 inches. Option C, 78 inches. Option D, 84 inches. The correct answer is option B, 72 inches. Multiplying 6 feet by 12 inches equals 72 inches. Question 202. Which of the following describes a skin tear? Option A, a deep bruise under the skin. Option B, a break or rip in the outer layer of the skin. Option C, a purple spot caused by aging. Option D, a large wart. The correct answer is option B, a break or rip in the outer layer of the skin. Skin tears are common in the elderly due to thin, fragile skin and can be caused by friction. Question 203. Where are venous ulcers commonly found? Option A, on the face and neck. Option B, on the lower legs or feet, such as the heels or inner ankles. Option C, on the palms of the hands. Option D, on the stomach and chest. The correct answer is option B, on the lower legs or feet, such as the heels or inner ankles. Venous ulcers are caused by poor blood return and often appear on the lower extremities. Question 204. Arterial ulcers are typically caused by which of the following? Option A, excessive moisture on the skin. Option B, poor blood flow from the heart to the extremities. Option C, lying in one position for too long. Option D, a bacterial infection in the blood. The correct answer is option B, poor blood flow from the heart to the extremities. Blocked or narrowed arteries prevent oxygen from reaching the tissues, leading to ulcers. Question 205. Where is the most common location for a decubitus or pressure ulcer to develop? Option A, the nose. Option B, the palms. Option C, the sacrum or tailbone. Option D, the shins. The correct answer is option C, the sacrum or tailbone. The sacrum is a major bony prominence that often bears the weight of the body in bed. Question 206. What happens to the tissues when gangrene occurs? Option A, they turn bright red and itchy. Option B, the tissues become black and die. Option C, they become very soft and moist. Option D, they grow extra layers of skin. The correct answer is option B, the tissues become black and die. Gangrene is tissue death caused by a lack of blood flow or a serious bacterial infection. Question 207. When is the best time to put on anti-embolism stockings? Option A, in the evening before bed. Option B, after the resident has walked for an hour. Option C, in the morning before they get out of bed. Option D, directly after a shower. The correct answer is option C, in the morning before they get out of bed. Applying stockings before the resident stands prevents blood from pooling and causing leg swelling. Question 208. What is a hot soak? Option A, taking a hot bath in a tub. Option B, placing a body part into warm water. Option C, applying a wet towel to the face. Option D, sitting in a steam room. The correct answer is option B, placing a body part into warm water. A hot soak involves immersing a specific body part, like a hand or foot, in warm water. Question 209. What is a sitz bath? Option A, a bath where the entire body is submerged. Option B, a bath where the perineal and rectal area are immersed in warm water. Option C, a bath used only for infants. Option D, a dry heat application using a heat lamp. The correct answer is option B, a bath where the perineal and rectal area are immersed in warm water. Sitz baths are used to soothe and heal the perineal area after surgery or childbirth. Question 210. What is a bony prominence? Option A, an area where the bone sticks out through the skin. Option B, an area where bone lies close to the skin surface. Option C, a type of bone cancer. Option D, a broken bone that has healed. The correct answer is option B, an area where bone lies close to the skin surface. Bony prominences like heels and hips are high-risk areas for pressure injuries. Question 211. In terms of skin health, what is friction? Option A, the layers of skin rubbing against each other. Option B, the rubbing of one thing against another. Option C, a bacterial infection of the skin. Option D, the process of skin healing. The correct answer is option B, the rubbing of one thing against another. Friction occurs when skin drags across a surface like a bed sheet, causing damage. Question 212. What is skin shearing? Option A, cutting the hair on the skin. Option B, when layers of skin rub against each other. Option C, the process of a wound closing. Option D, a type of skin rash. The correct answer is option B, when layers of skin rub against each other. Shearing occurs when the skin stays in place while the underlying bone and tissue move. Question 213. What is eschar? Option A. A type of clear fluid from a wound. Option B. Black, dead tissue found in a wound. Option C. A surgical drain. Option D. New skin growth. The correct answer is option B. Black, dead tissue found in a wound. Eschar is thick, leathery, dead tissue that often covers deep pressure ulcers. Question 214. What is slough? Option A. New muscle tissue. Option B. Yellow or white stringy tissue in a wound. Option C. A type of cleaning solution. Option D. A medicated bandage. The correct answer is option B. Yellow or white stringy tissue in a wound. Slough is dead tissue that must be removed for a wound to heal properly. Question 215. What is a pressure ulcer? Option A. A rash caused by an allergy. Option B. Injury to the skin and underlying tissue caused by constant pressure. Option C. A bruise from a fall. Option D. A cut from a sharp object. The correct answer is option B. Injury to the skin and underlying tissue caused by constant pressure. Pressure ulcers are also known as bed sores and are preventable with proper care. Question 216. How often should a person's position be changed when they are sitting in a chair? Option A. Every hour. Option B. Every 2 hours. Option C. Every 15 minutes. Option D. Once a day. The correct answer is option C. Every 15 minutes. Frequent shifts are needed because sitting puts high pressure on small areas like the tailbone. Question 217. What is a prosthesis? Option A. A type of hearing aid. Option B. An artificial limb or replacement part for the body. Option C. A special type of wheelchair. Option D. A medical diagnosis. The correct answer is option B. An artificial limb or replacement part for the body. Prosthetics include items like artificial legs, arms, and glass eyes. Question 218. What is the definition of rehabilitation? Option A. The process of a resident getting older. Option B. Restoring a disabled person to the highest level of functioning possible. Option C. Providing comfort care only. Option D. Moving a resident to a different facility. The correct answer is option B. Restoring a disabled person to the highest level of functioning possible. Rehabilitation involves therapies designed to regain lost skills and independence. Question 219. What is a restorative aid? Option A. A specialized type of walker. Option B. A nursing assistant with special training in restorative nursing and rehab. Option C. A medication that restores memory. Option D. A device used to help a resident breathe. The correct answer is option B. A nursing assistant with special training in restorative nursing and rehab. Restorative aids assist residents with exercises and functional training. Question 220. Restorative nursing care is best described as which of the following? Option A. Care that focuses only on the resident's spiritual needs. Option B. Care that helps people regain health, strength, and independence. Option C. Care that is only provided in a hospital. Option D. Care that involves performing surgeries. The correct answer is option B. Care that helps people regain health, strength, and independence. Restorative nursing maintains the gains made during formal rehabilitation. Question 221. What is the clinical definition of anxiety? Option A. A sudden loss of memory. Option B. An uneasy feeling in response to stress. Option C. The belief that you are a famous person. Option D. A physical injury to the brain. The correct answer is option B. An uneasy feeling in response to stress. Anxiety is a common mental health response to change, illness, or stress. Question 222. What is a compulsion? Option A. A recurrent unwanted thought. Option B. Repeating an act more than once or multiple times. Option C. The belief that someone is following you. Option D. A sudden feeling of intense fear. The correct answer is option B. Repeating an act more than once or multiple times. Compulsions are ritualistic behaviors a person feels driven to perform. Question 223. What is a delusion of grandeur? Option A. The fear of being in small spaces. Option B. The reliving of a trauma. Option C. An exaggerated belief about one's own importance, wealth, or power. Option D. The loss of the ability to speak. The correct answer is option C. An exaggerated belief about one's own importance, wealth, or power. Delusions of grandeur are false beliefs where a person thinks they are famous or powerful. Question 224. What is a flashback? Option A. A sudden loss of consciousness. Option B. Reliving a trauma throughout the day or while sleeping. Option C. A type of bright light used in therapy. Option D. A temporary improvement in memory. The correct answer is option B. Reliving a trauma throughout the day or while sleeping. Flashbacks are common in post-traumatic stress disorder. Question 225. What is a hallucination? Option A. A false belief about a situation. Option B. Seeing, hearing, smelling, or feeling unreal things. Option C. The inability to move a limb. Option D. A loss of appetite. The correct answer is option B. Seeing, hearing, smelling, or feeling unreal things. Hallucinations are sensory experiences that occur without an external stimulus. Question 226. What is an obsession? Option A. A ritualistic behavior. Option B. A recurrent, unwanted thought, idea, or image. Option C. An intense fear of a specific object. Option D. A state of severe confusion. The correct answer is option B. A recurrent, unwanted thought, idea, or image. Obsessions are intrusive thoughts that cause significant anxiety. Question 227. What is panic? Option A. An intense and sudden feeling of fear, anxiety, or terror. Option B. A long-term state of sadness. Option C. A type of physical exercise. Option D. A normal response to a joke. The correct answer is option A. An intense and sudden feeling of fear, anxiety, or terror. Panic attacks involve overwhelming physical and emotional distress. Question 228. What is paranoia? Option A. A state of extreme happiness. Option B. False beliefs and suspicion about a person or situation. Option C. The loss of hearing. Option D. A type of skin infection. The correct answer is option B. False beliefs and suspicion about a person or situation. Paranoid individuals may believe others are trying to harm or plot against them. Question 229. What is a phobia? Option A. An intense fear of a specific object or situation. Option B. A loss of the sense of taste. Option C. A type of medication used for sleep. Option D. A state of total memory loss. The correct answer is option A. An intense fear of a specific object or situation. Phobias are irrational and excessive fears that interfere with daily life. Question 230. What is suicide contagion? Option A. A disease that causes suicidal thoughts. Option B. Exposure to suicide or suicidal behaviors within a group of people. Option C. A type of biological weapon. Option D. The fear of death. The correct answer is option B. Exposure to suicide or suicidal behaviors within a group of people. Contagion refers to the increased risk of suicide after exposure to other suicides. Question 231. What is withdrawal syndrome? Option A. A type of physical exercise for the legs. Option B. A physical and medical response after stopping a regularly used substance. Option C. The process of moving a resident to a new room. Option D. A symptom of a common cold. The correct answer is option B. A physical and medical response after stopping a regularly used substance. Withdrawal occurs when the body reacts to the absence of a drug or alcohol it has become dependent on. Question 232. What does the abbreviation BPD stand for in mental health? Option A. Bipolar personality disease. Option B. Borderline personality disorder. Option C. Basic psychological development. Option D. Brief panic disorder. The correct answer is option B. Borderline personality disorder. Borderline personality disorder affects how a person feels about themselves and others. Question 233. What does the abbreviation PTSD stand for? Option A. Physical therapy and social development. Option B. Post-traumatic stress disorder. Option C. Permanent tissue and skin damage. Option D. Partial temporal seizure disorder. The correct answer is option B, post-traumatic stress disorder. Post-traumatic stress disorder is a mental health condition triggered by a terrifying event. Question 234. What does the abbreviation OCD stand for? Option A, overactive cardiac drive. Option B, obsessive compulsive disorder. Option C, oral care and dental hygiene. Option D, orthopedic clinical diagnosis. The correct answer is option B, obsessive compulsive disorder. Obsessive compulsive disorder involves patterns of unwanted thoughts and repetitive behaviors. Question 235. How is schizophrenia best defined? Option A, a loss of memory due to aging. Option B, a split mind or a brain disorder that affects how a person thinks and behaves. Option C, a temporary state of confusion. Option D, a type of physical paralysis. The correct answer is option B, a split mind or a brain disorder that affects how a person thinks and behaves. Schizophrenia is a chronic and severe mental disorder involving distorted reality. Question 236. In terms of mental health, what does mania refer to? Option A, a state of deep depression. Option B, emotional highs and extreme energy or agitation. Option C, a fear of being alone. Option D, the inability to sleep. The correct answer is option B, emotional highs and extreme energy or agitation. Mania is often a phase of bipolar disorder characterized by euphoria and hyperactivity. Question 237. True or false, alcoholism can be fully cured with the right medication? Option A, true. Option B, false. The correct answer is option B, false. Alcoholism is considered a chronic disease that can be managed but not cured. Question 238. What is the clinical definition of cognitive function? Option A, the ability of the body to move. Option B, memory, thinking, reasoning, and the ability to understand. Option C, the process of digestion. Option D, the function of the heart and lungs. The correct answer is option B, memory, thinking, reasoning, and the ability to understand. Cognitive function relates to the brain's ability to process and retain information. Question 239. What is confusion? Option A, a state of extreme physical fitness. Option B, a mental state of being disoriented to person, time, place, or identity. Option C, the loss of the ability to walk. Option D, a normal part of the aging process. The correct answer is option B, a mental state of being disoriented to person, time, place, or identity. Confusion can be temporary or permanent and affects a person's orientation. Question 240. What is delirium? Option A, a slow and gradual decline in memory. Option B, a state of sudden, severe confusion and rapid changes in brain function. Option C, a type of physical seizure. Option D, a state of deep sleep. The correct answer is option B, a state of sudden, severe confusion and rapid changes in brain function. Delirium is often temporary and can be caused by infection or medication reactions. Question 241. What is dementia? Option A, a normal loss of memory that happens to everyone. Option B, the loss of cognitive function that interferes with routine activities. Option C, a temporary state of agitation at night. Option D, a physical injury to the spine. The correct answer is option B, the loss of cognitive function that interferes with routine activities. Dementia is a group of symptoms caused by various brain diseases, including Alzheimer's. Question 242. What is sundowning? Option A, when a resident feels better in the morning. Option B, the process of the sun setting. Option C, when signs and behaviors of Alzheimer's increase during hours of darkness. Option D, a type of skin rash caused by the sun. The correct answer is option C, when signs and behaviors of Alzheimer's increase during hours of darkness. Sundowning involves increased confusion and agitation in the late afternoon and evening. Question 243. What is fainting? Option A, a sudden loss of memory. Option B, a sudden loss of consciousness from a lack of blood supply to the brain. Option C, a type of physical exercise. Option D, a normal way to fall asleep. The correct answer is option B, a sudden loss of consciousness from a lack of blood supply to the brain. Fainting is often preceded by dizziness, sweating, or blurred vision. Question 244. What is a hemorrhage? Option A. A type of severe headache. Option B. The excessive loss of blood in a short period of time. Option C. A blockage in the digestive tract. Option D. A type of skin ulcer. The correct answer is option B. The excessive loss of blood in a short period of time. Hemorrhaging is a medical emergency that requires immediate pressure and intervention. Question 245. What is respiratory arrest? Option A. When the heart stops beating. Option B. When breathing stops but the heart continues to beat for a few minutes. Option C. A type of severe cough. Option D. The loss of the sense of smell. The correct answer is option B. When breathing stops but the heart continues to beat for a few minutes. Respiratory arrest requires immediate rescue breathing to prevent cardiac arrest. Question 246. What is a seizure? Option A. A sudden loss of the ability to speak. Option B. Violent and sudden contractions or tremors of muscle groups. Option C. A type of severe muscle cramp. Option D. A state of deep depression. The correct answer is option B. Violent and sudden contractions or tremors of muscle groups. Seizures are caused by abnormal electrical activity in the brain. Question 247. In an emergency, what is shock? Option A. A state of being surprised. Option B. When organs and tissues do not get enough blood. Option C. A type of electrical injury. Option D. A sudden loud noise. The correct answer is option B. When organs and tissues do not get enough blood. Shock is a life-threatening condition that requires immediate medical treatment. Question 248. What is sudden cardiac arrest? Option A. When the heart stops suddenly and without warning. Option B. A slow decline in heart function over years. Option C. A type of chest pain. Option D. When a person stops breathing but their heart continues. The correct answer is option A. When the heart stops suddenly and without warning. Sudden cardiac arrest results in immediate loss of consciousness and requires cardiopulmonary resuscitation. Question 249. What does the abbreviation AED stand for? Option A. Advanced Emergency Device. Option B. Automated External Defibrillator. Option C. Aged and Elderly Department. Option D. Airway and Esophagus Drain. The correct answer is option B. Automated External Defibrillator. An automated external defibrillator is used to deliver a shock to the heart during cardiac arrest. Question 250. What does the abbreviation BLS stand for? Option A. Basic Life Support. Option B. Blood Level Survey. Option C. Breathing and Lung Safety. Option D. Body Language Study. The correct answer is option A. Basic Life Support. Basic life support includes procedures like cardiopulmonary resuscitation and choking relief. Question 251. What does RRT stand for in a hospital or facility? Option A. Resident Recovery Team. Option B. Rapid Response Team. Option C. Radiology and Radiation Therapy. Option D. Routine Recording Task. The correct answer is option B. Rapid Response Team. A rapid response team is called when a resident shows signs of severe clinical decline. Question 252. What is the ratio of chest compressions to rescue breaths during adult cardiopulmonary resuscitation? Option A. 15 compressions to 2 breaths. Option B. 30 compressions to 2 breaths. Option C. 10 compressions to 1 breath. Option D. 50 compressions to 5 breaths. The correct answer is option B. 30 compressions to 2 breaths. The standard ratio for adult CPR is 30 compressions followed by 2 breaths. Question 253. What is a thrombus? Option A. A blood clot that has broken off and is traveling. Option B. A blood clot that is still attached to the wall of a vessel. Option C. A type of muscle tumor. Option D. A blockage in the airway. The correct answer is option B. A blood clot that is still attached to the wall of a vessel. A thrombus can block blood flow and lead to serious conditions like a heart attack. Question 254. What is an embolus? Option A. A blood clot that stays in one place. Option B. A blood clot or object that has broken off and is traveling through the blood. Option C. a type of severe skin rash. Option D, a sudden loss of memory. The correct answer is option B, a blood clot or object that has broken off and is traveling through the blood. An embolus can travel to the lungs or brain, causing life-threatening complications. Question 255. What is anaphylactic shock? Option A, a type of shock caused by blood loss. Option B, a severe and life-threatening allergic reaction. Option C, a state of confusion caused by a stroke. Option D, the response of the body to extreme cold. The correct answer is option B, a severe and life-threatening allergic reaction. Anaphylaxis causes swelling of the airway and requires immediate medication. Question 256. What is a cerebrovascular accident? Option A, a serious car accident. Option B, the medical term for a stroke. Option C, a broken bone in the spine. Option D, a type of heart attack. The correct answer is option B, the medical term for a stroke. A cerebrovascular accident occurs when blood flow to the brain is interrupted. Question 257. What is a partial seizure? Option A, a seizure where the person loses total consciousness. Option B, a seizure where only one part of the brain is involved and consciousness is maintained. Option C, a seizure that lasts for only 1 second. Option D, a seizure that only affects the legs. The correct answer is option B, a seizure where only one part of the brain is involved and consciousness is maintained. During a partial seizure, the person may experience sensory changes or involuntary movements. Question 258. What is a tonic-clonic or grand mal seizure? Option A, a seizure where the person remains fully awake. Option B, a seizure involving loss of consciousness and violent muscle contractions. Option C, a seizure that only involves the eyes. Option D, a seizure caused by low blood sugar. The correct answer is option B, a seizure involving loss of consciousness and violent muscle contractions. Tonic-clonic seizures are the most common type of generalized seizure. Question 259. What are advance directives? Option A, instructions on how to perform a surgery. Option B, documents stating a person's wishes about health care when they cannot make decisions. Option C, the rules and regulations of the facility. Option D, a type of medication used for pain. The correct answer is option B, documents stating a person's wishes about health care when they cannot make decisions. Advance directives include living wills and durable powers of attorney for health care. Question 260. What is the goal of palliative care? Option A, to perform aggressive surgeries to find a cure. Option B, to relieve or reduce the intensity of uncomfortable symptoms without a cure. Option C, to provide physical therapy for a full recovery. Option D, to help a resident move to a new home. The correct answer is option B, to relieve or reduce the intensity of uncomfortable symptoms without a cure. Palliative care focuses on quality of life and comfort for those with serious illnesses. Question 261. What is postmortem care? Option A, care given to a resident right before they die. Option B, care of the body after death. Option C, the process of reading a person's will. Option D, a type of spiritual counseling. The correct answer is option B, care of the body after death. Postmortem care involves cleaning and positioning the body with respect. Question 262. What is reincarnation? Option A, the belief that a person only lives once. Option B, the belief that the spirit or soul is reborn in another form of life. Option C, a type of medical treatment for the elderly. Option D, the process of a body decaying. The correct answer is option B, the belief that the spirit or soul is reborn in another form of life. Religious and cultural beliefs about reincarnation can affect how a family views death. Question 263. What is rigor mortis? Option A, a state of deep sleep after death. Option B, the stiffness of skeletal muscles that occurs after death. Option C, a type of infection that causes skin to rot. Option D, the process of the heart stopping. The correct answer is option B, the stiffness of skeletal muscles that occurs after death. Rigor mortis makes the body difficult to move and typically begins a few hours after death. Question 264. Which statement best describes hospice care? Option A, care that is focused on curing a terminal illness. Option B, care for dying persons and their families that focuses on comfort and dignity. Option C, care that is only provided in a hospital intensive care unit. Option D, a program designed to help residents return to work. The correct answer is option B, care for dying persons and their families that focuses on comfort and dignity. Hospice care is typically for those with 6 months or less to live. Question 265. In the stages of dying, what is the denial stage? Option A, the person is calm and at peace. Option B, the person refuses to believe that he or she is dying. Option C, the person asks why me and is very upset. Option D, the person makes promises to God for more time. The correct answer is option B, the person refuses to believe that he or she is dying. Denial is a common initial defense mechanism when facing a terminal diagnosis. Question 266. In the stages of dying, what is the anger stage? Option A, the person is sad and withdrawn. Option B, the person asks why me and may be difficult to care for. Option C, the person accepts that death is near. Option D, the person refuses to talk to anyone. The correct answer is option B, the person asks why me and may be difficult to care for. Anger is a normal response to the loss of control and the end of life. Question 267. In the stages of dying, what is the bargaining stage? Option A, the person is very depressed. Option B, the person tries to make deals with a higher power for more time. Option C, the person is happy and relieved. Option D, the person avoids all medical treatment. The correct answer is option B, the person tries to make deals with a higher power for more time. Bargaining often involves the hope of reaching a specific milestone or event. Question 268. In the stages of dying, what is the depression stage? Option A, the person is angry at the staff. Option B, the person becomes very sad and may withdraw from others. Option C, the person is in a state of shock. Option D, the person is ready to die. The correct answer is option B, the person becomes very sad and may withdraw from others. Depression is a natural part of the grieving process as the person realizes death is inevitable. Question 269. In the stages of dying, what is the acceptance stage? Option A, the person is in denial about their health. Option B, the person is calm and at peace with the end of life. Option C, the person is still trying to find a cure. Option D, the person is very fearful of the future. The correct answer is option B, the person is calm and at peace with the end of life. Acceptance is often the final stage before death occurs. Question 270. Which sense is generally thought to be the last function to leave the body at death? Option A, sight. Option B, taste. Option C, hearing. Option D, smell. The correct answer is option C, hearing. It is important to continue talking to and comforting a dying resident as they may still hear you. Question 271. What typically happens to the body circulation as death approaches? Option A, circulation improves and skin becomes warm. Option B, circulation fails and the skin becomes cool, pale, and blotchy. Option C, the heart rate increases significantly. Option D, the blood pressure becomes very high. The correct answer is option B, circulation fails and the skin becomes cool, pale, and blotchy. Mottling and cold extremities are clinical signs that the body's systems are shutting down. Question 272. In blood pressure, what is the diastolic reading? Option A, the top number. Option B, the bottom number. Option C, the average of 3 readings. Option D, the pulse rate. The correct answer is option B, the bottom number. The diastolic pressure represents the pressure in the arteries when the heart is at rest. Question 273. In blood pressure, what is the systolic reading? Option A, the bottom number. Option B, the pulse rate. Option C, the top number. Option D, the temperature. The correct answer is option C, the top number. The systolic pressure represents the pressure in the arteries when the heart is contracting. Question 274. What is the clinical definition of hypotension? Option A, high blood pressure. Option B, normal blood pressure. Option C, low blood pressure. Option D, rapid heart rate. The correct answer is option C, low blood pressure. Hypotension can cause dizziness and fainting and may require medical attention. Question 275. What is the clinical definition of hypertension? Option A, low blood pressure. Option B, high blood pressure. Option C, slow heart rate. Option D, high body temperature. The correct answer is option B, high blood pressure. Chronic hypertension is a major risk factor for heart disease and stroke. Question 276. What is inhalation? Option A, breathing out. Option B, holding your breath. Option C, breathing in. Option D, a type of severe cough. The correct answer is option C, breathing in. Inhalation brings oxygen into the lungs to be distributed to the body. Question 277. What is exhalation? Option A, breathing in. Option B, breathing out. Option C, a sudden loss of breath. Option D, a type of medical equipment. The correct answer is option B, breathing out. Exhalation removes carbon dioxide from the body. Question 278. Where is an axillary temperature taken? Option A, in the mouth. Option B, in the ear. Option C, under the arm. Option D, on the forehead. The correct answer is option C, under the arm. The axilla is the medical term for the armpit. Question 279. Where is a tympanic temperature taken? Option A, in the rectum. Option B, in the ear. Option C, on the wrist. Option D, under the tongue. The correct answer is option B, in the ear. Tympanic thermometers measure the heat from the eardrum. Question 280. Where is a temporal temperature taken? Option A, scanning the forehead. Option B, inside the mouth. Option C, under the arm. Option D, on the chest. The correct answer is option A, scanning the forehead. Temporal artery thermometers are non-invasive and quick. Question 281. Where is a rectal temperature taken? Option A, in the ear. Option B, in the mouth. Option C, in the rectum. Option D, under the arm. The correct answer is option C, in the rectum. Rectal temperatures are accurate but must be done with great care. Question 282. Where is an oral temperature taken? Option A, in the rectum. Option B, in the mouth. Option C, in the ear. Option D, on the forehead. The correct answer is option B, in the mouth. Oral is the most common site for taking a temperature in conscious adults. Question 283. Where is the carotid pulse located? Option A, at the wrist. Option B, in the neck. Option C, over the heart. Option D, at the groin. The correct answer is option B, in the neck. The carotid pulse is used during emergency situations like cardiopulmonary resuscitation. Question 284. Where is the apical pulse taken? Option A, at the wrist. Option B, over the heart with a stethoscope. Option C, inside the elbow. Option D, behind the knee. The correct answer is option B, over the heart with a stethoscope. The apical pulse is the most accurate measurement of the actual heart rate. Question 285. Where is the brachial pulse located? Option A, at the wrist. Option B, on the inside of the elbow. Option C, in the neck. Option D, at the top of the foot. The correct answer is option B, on the inside of the elbow. The brachial pulse is commonly used when taking a manual blood pressure. Question 286. Where is the radial pulse located? Option A, in the neck. Option B, at the wrist on the thumb side. Option C, at the groin. Option D, behind the ankle. The correct answer is option B, at the wrist on the thumb side. The radial site is the most common place to count a pulse for routine vital signs. Question 287. Where is the femoral pulse located? Option A, behind the knee. Option B, at the groin. Option C, in the neck. Option D, at the wrist. The correct answer is option B, at the groin. The femoral artery is a major vessel located in the crease of the leg. Question 288. What is bradypnea? Option A, rapid breathing. Option B, slow breathing. Option C, absence of breathing. Option D, painful breathing. The correct answer is option B, slow breathing. Bradypnea involves a respiration rate that is lower than the normal range. Question 289. What is tachypnea? Option A, slow breathing. Option B, rapid breathing. Option C, normal breathing. Option D, difficulty breathing while lying down. The correct answer is option B, rapid breathing. Tachypnea is a respiration rate that is higher than 20 breaths per minute. Question 290. What is radiating pain? Option A, pain that stays in one spot. Option B, pain that is felt at the site of tissue damage and in nearby areas. Option C, pain that only lasts for a second. Option D, pain that is caused by heat. The correct answer is option B, pain that is felt at the site of tissue damage and in nearby areas. An example of radiating pain is a heart attack where pain moves from the chest to the arm. Question 291. What is phantom pain? Option A, pain caused by a ghost. Option B, pain felt on a body part that is no longer there. Option C, pain that comes and goes. Option D, pain that cannot be explained. The correct answer is option B, pain felt on a body part that is no longer there. Phantom pain is real pain felt after an amputation and must be treated. Question 292. What is a microbe? Option A, a large animal. Option B, a small living thing seen only with a microscope. Option C, a type of medical equipment. Option D, a symptom of a cold. The correct answer is option B, a small living thing seen only with a microscope. Microbes include bacteria, viruses, and fungi. Question 293. What is the definition of disinfection? Option A, the process of killing all microbes. Option B, the process of destroying pathogens. Option C, washing hands with soap. Option D, applying a bandage. The correct answer is option B, the process of destroying pathogens. Disinfection reduces the number of harmful microbes on a surface. Question 294. What is a pathogen? Option A, a microbe that is helpful to the body. Option B, a microbe that is harmful and can cause infection. Option C, a type of cleaning chemical. Option D, a professional healthcare worker. The correct answer is option B, a microbe that is harmful and can cause infection. Pathogens are responsible for causing diseases. Question 295. What does the term sterile mean? Option A, the presence of some bacteria. Option B, the absence of all microbes. Option C, being very clean. Option D, free of visible dirt. The correct answer is option B, the absence of all microbes. Sterility is required for procedures like surgery or catheter insertion. Question 296. What is a sepsis? Option A, a severe infection in the blood. Option B, being free of disease-producing microbes. Option C, the process of a wound healing. Option D, a type of medical diagnosis. The correct answer is option B, being free of disease-producing microbes. A sepsis prevents the spread of infection from one person to another. Question 297. What does the abbreviation A and O stand for? Option A, air and oxygen. Option B, alert and oriented. Option C, active and outgoing. Option D, average and ordinary. The correct answer is option B, alert and oriented. This term is used to describe a resident's level of consciousness. Question 298. What does the abbreviation ABD stand for? Option A, advanced body development. Option B, abdomen. Option C, airborne disease. Option D, above bed device. The correct answer is option B, abdomen. The abdomen is the part of the body containing the digestive organs. Question 299. What does the abbreviation AC stand for in medical timing? Option A, after meals. Option B, before meals. Option C, at bedtime. Option D, as requested. The correct answer is option B, before meals. The abbreviation comes from the Latin anti-cibum. Question 300. What does AKA stand for in surgery? Option A, above knee amputation. Option B, also known as. Option C, acute kidney ailment. Option D, active knee alignment. The correct answer is option A, above knee amputation. This identifies the level at which a limb was removed. Question 301. What does the abbreviation AMB stand for? Option A, ambulance. Option B, ambulate or walk. Option C, ambidextrous. Option D, ambient temperature. The correct answer is option B, ambulate or walk. Ambulation is the medical term for walking. Question 302. What does the abbreviation ASAP stand for? Option A, as soon as possible. Option B, as simple as possible. Option C, active safety and protection. Option D, after small amount provided. The correct answer is option A, as soon as possible. This indicates that a task should be prioritized. Question 303. What does the abbreviation BID stand for? Option A, once a day. Option B, twice a day. Option C, 3 times a day. Option D, every other day. The correct answer is option B, twice a day. The abbreviation comes from the Latin bis in die. Question 304. What does the abbreviation BKA stand for? Option A, below knee amputation. Option B, bowel and kidney assessment. Option C, body keen awareness. Option D, basic knee adjustment. The correct answer is option A, below knee amputation. This identifies that the amputation occurred below the knee joint. Question 305. What does the abbreviation BM stand for? Option A, a blood monitor. Option B, bowel movement. Option C, body Massachusetts. Option D, breathing method. The correct answer is option B, bowel movement. A bowel movement is the excretion of feces from the body. Question 306. What does the abbreviation BP stand for? Option A, body position. Option B, blood pressure. Option C, breathing pattern. Option D, basic procedure. The correct answer is option B, blood pressure. Blood pressure is a key vital sign measured in millimeters of mercury. Question 307. What does the abbreviation BPM stand for? Option A, beats or breaths per minute. Option B, body pressure monitor. Option C, basic patient management. Option D, bed position manual. The correct answer is option A, beats or breaths per minute. This unit is used when measuring pulse or respirations. Question 308. What does the abbreviation BRP stand for? Option A, bed rest prescribed. Option B, bathroom privileges. Option C, basic room protocol. Option D, breathing rate pattern. The correct answer is option B, bathroom privileges. Bathroom privileges mean the resident is allowed to use the toilet. Question 309. What does the abbreviation COPD stand for? Option A, chronic obstructive pulmonary disease. Option B, cardiac output and pulse drive. Option C, common oral pressure disorder. Option D, central observation and patient data. The correct answer is option A, chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is a long-term lung condition that makes breathing difficult. Question 310. What does the abbreviation DNR stand for? Option A, do not remove. Option B, do not resuscitate. Option C, daily nursing report. Option D, decision not required. The correct answer is option B, do not resuscitate. A do not resuscitate order means medical staff will not attempt CPR. Question 311. What does the abbreviation DOA stand for? Option A, date of admission. Option B, dead on arrival. Option C, daily observation area. Option D, dietary order assigned. The correct answer is option B, dead on arrival. This term is used when a person is deceased before reaching the facility. Question 312. What does the abbreviation DVT stand for? Option A, deep venous thrombosis. Option B, daily vital trend. Option C, dietary and vitamin therapy. Option D, digital volume target. The correct answer is option A, deep venous thrombosis. Deep venous thrombosis is a blood clot in a deep vein, usually in the leg. Question 313. What does the abbreviation GI stand for? Option A, general infirmary. Option B, gastrointestinal. Option C, genitourinary. Option D, gravity intake. The correct answer is option B, gastrointestinal. The gastrointestinal system includes the stomach and intestines. Question 314. What does the abbreviation HOB stand for? Option A, heart of body. Option B, head of bed. Option C, height of body. Option D, hand over bed. The correct answer is option B, head of bed. Instructions often specify a certain angle for the head of the bed. Question 315. What does the abbreviation HOH stand for? Option A, hard of hearing. Option B, head of household. Option C, height of heels. Option D, history of health. The correct answer is option A, hard of hearing. Communication techniques should be adjusted for hard of hearing residents. Question 316. What does the abbreviation HR stand for? Option A, health record. Option B, heart rate. Option C, high risk. Option D, hourly report. The correct answer is option B, heart rate. The heart rate is measured in beats per minute. Question 317. What does the abbreviation HS stand for in timing? Option A, half strength. Option B, at bedtime. Option C, high stress. Option D, home safety. The correct answer is option B, at bedtime. The abbreviation comes from the Latin ora somni. Question 318. What does the abbreviation INO stand for? Option A, in and out. Option B, intake and output. Option C, internal and occupational. Option D, illness and observation. The correct answer is option B, intake and output. Intake and output tracks the amount of fluid a resident consumes and excretes. Question 319. What does the abbreviation ICU stand for? Option A, individual care unit. Option B, intensive care unit. Option C, intravenous control unit. Option D, infection control unit. The correct answer is option B, intensive care unit. The intensive care unit provides specialized care for critically ill patients. Question 320. What does the abbreviation IV stand for? Option A, individual visit. Option B, intravenous. Option C, involuntary. Option D, internal valve. The correct answer is option B, intravenous. Intravenous means within a vein, usually referring to fluids or medications. Question 321. What does the abbreviation kg stand for? Option A, known group. Option B, kilogram. Option C, knee girth. Option D, key goal. The correct answer is option B, kilogram. 1 kilogram is equal to approximately 2.2 pounds. Question 322. What does the abbreviation L stand for on a chart? Option A, large. Option B, left. Option C, low. Option D, leader. The correct answer is option B, left. This indicates the left side of the resident's body. Question 323. What does the abbreviation ml stand for? Option A, meter length. Option B, milliliter. Option C, milligram. Option D, monitor level. The correct answer is option B, milliliter. Milliliters are the metric unit used to measure liquid volume. Question 324. What does the abbreviation MS stand for? Option A, medical staff. Option B, multiple sclerosis. Option C, mental state. Option D, muscle strength. The correct answer is option B, multiple sclerosis. Multiple sclerosis is a chronic disease that affects the central nervous system. Question 325. What does the abbreviation NG stand for? Option A, near goal. Option B, nasogastric. Option C, normal girth. Option D, nursing group. The correct answer is option B, nasogastric. Nasogastric refers to a tube that goes from the nose to the stomach. Question 326. What does NKA stand for? Option A, normal knee alignment. Option B, no known allergies. Option C, nursing knowledge area. Option D, new kidney assessment. The correct answer is option B, no known allergies. This indicates that a resident has no documented allergies. Question 327. What does NKDA stand for? Option A, normal kidney daily action. Option B, no known drug allergies. Option C, negative knee drive assessment. Option D, nursing key duty assigned. The correct answer is option B, no known drug allergies. This means the resident has no known allergies to medications. Question 328. What does NPO stand for? Option A, new patient only. Option B, nothing by mouth. Option C, normal pulse only. Option D, nighttime position order. The correct answer is option B, nothing by mouth. Nothing by mouth is a medical order to stop all food and fluid intake. Question 329. What does the abbreviation OS stand for in eye care? Option A, opening system. Option B, left eye. Option C, both eyes. Option D, right eye. The correct answer is option B, left eye. The abbreviation comes from the Latin oculus sinister. Question 330. What does the abbreviation OU stand for in eye care? Option A, opening unit. Option B, both eyes. Option C, one unit. Option D, only under. The correct answer is option B, both eyes. The abbreviation comes from the Latin oculus uterc. Question 331. What does the abbreviation PC stand for in medical timing? Option A, post-care. Option B, after meals. Option C, pulse count. Option D, prior to care. The correct answer is option B, after meals. The abbreviation comes from the Latin post-cibum. Question 332. What does the abbreviation PO stand for? Option A, phone order. Option B, by mouth. Option C, partial observation. Option D, postoperative. The correct answer is option B, by mouth. The abbreviation comes from the Latin per os, meaning by mouth. Question 333. What does the abbreviation PRN stand for? Option A, primary resident need. Option B, as needed. Option C, partial record note. Option D, position resident now. The correct answer is option B, as needed. The abbreviation comes from the Latin pro re nata. Question 334. What does the abbreviation PT stand for? Option A, point. Option B, patient. Option C, pulse time. Option D, partial. The correct answer is option B, patient. This is a common shorthand for a person receiving care. Question 335. What does the abbreviation Q stand for? Option A, quiet. Option B, every. Option C, quantity. Option D, quick. The correct answer is option B, every. The abbreviation comes from the Latin quisque, meaning every. Question 336. What does the abbreviation OD stand for in eye care? Option A, open daily. Option B, right eye. Option C, optical depth. Option D, only during. The correct answer is option B, right eye. The abbreviation comes from the Latin oculus dexter. Question 337. What does the abbreviation QD stand for? Option A, quarterly dose. Option B, every day. Option C, quiet day. Option D, quality delivery. The correct answer is option B, every day. The abbreviation comes from the Latin quaeque die. Question 338. What does the abbreviation QH stand for? Option A, quiet hour. Option B, every hour. Option C, quantity high. Option D, quick help. The correct answer is option B, every hour. The abbreviation comes from the Latin quaeque ora. Question 339. What does the abbreviation Q4H stand for? Option A, quality for health. Option B, every 4 hours. Option C, quantity for hourly. Option D, quick 4 hits. The correct answer is option B, every 4 hours. This means a task is performed at 4-hour intervals. Question 340. What does the abbreviation QID stand for? Option A, once a day. Option B, 4 times a day. Option C, quality in detail. Option D, quick internal drain. The correct answer is option B, 4 times a day. The abbreviation comes from the Latin quater and die. Question 341. What does the abbreviation QOD stand for? Option A, quality of diet. Option B, every other day. Option C, quiet observation dose. Option D, quick onset daily. The correct answer is option B, every other day. This means a task is performed on alternating days. Question 342. What does the abbreviation R stand for on a chart? Option A, rectal. Option B, right. Option C, rest. Option D, respiration. The correct answer is option B, right. This indicates the right side of the resident's body. Question 343. What does the abbreviation S with a line over it stand for? Option A, with. Option B, without. Option C, stable. Option D, small. The correct answer is option B, without. The abbreviation comes from the Latin sign, meaning without. Question 344. What does the abbreviation SOB stand for? Option A, stable or balanced. Option B, shortness of breath. Option C, skin on bone. Option D, side of bed. The correct answer is option B, shortness of breath. Shortness of breath is also known as dyspnea. Question 345. What does the abbreviation TID stand for? Option A, twice a day. Option B, 3 times a day. Option C, 10 times daily. Option D, total intake daily. The correct answer is option B, 3 times a day. The abbreviation comes from the Latin term die. Question 346. What does the abbreviation UA stand for? Option A, unit assistant. Option B, urinalysis. Option C, underarm. Option D, upper abdomen. The correct answer is option B, urinalysis. Urinalysis is a laboratory test of the urine. Question 347. What does the abbreviation UTI stand for? Option A, upper tissue injury. Option B, urinary tract infection. Option C, under threshold intake. Option D, unstable temperature increase. The correct answer is option B, urinary tract infection. Urinary tract infections are very common among nursing home residents. Question 348. What specific factor of hand washing is most responsible for removing germs? Option A, the temperature of the water. Option B, friction. Option C, the scent of the soap. Option D, the brand of paper towel. The correct answer is option B, friction. The mechanical action of rubbing the skin removes pathogens. Question 349. On which side should a resident hold a cane for the best support? Option A, the weak side. Option B, the strong side. Option C, the side the resident prefers. Option D, it does not matter. The correct answer is option B, the strong side. Holding the cane on the strong side helps offset weight from the weak side. Question 350. If a resident has had a stroke and their left side is weak, which side do you dress first? Option A, the right side. Option B, the left side. Option C, the side with the best circulation. Option D, the side without the hospital band. The correct answer is option B, the left side. Always dress the weak or affected side first to ensure proper positioning. Question 351. When restocking a resident's room with supplies, where should the new items go? Option A, on top of the old supplies. Option B, behind the existing supplies. Option C, in the hallway. Option D, on the floor. The correct answer is option B, behind the existing supplies. First in, first out rotation ensures that supplies do not expire. Question 352. What is the correct way to apply a gait belt? Option A, apply it loosely around the neck. Option B, apply it around the waist with the buckle off to the side. Option C, apply it over the bare skin. Option D, apply it as tight as possible around the chest. The correct answer is option B, apply it around the waist with the buckle off to the side. Correct application ensures the belt does not slide and provides a secure grip. Question 353. Where does the nursing assistant record the resident's fluid intake and output? Option A, on the resident's door. Option B, on the flow or graphic sheet. Option C, in the resident's diary. Option D, on the kitchen menu. The correct answer is option B, on the flow or graphic sheet. Accurate recording is necessary to monitor the resident's hydration and health status. Question 354. Where should a used ostomy pouch be disposed of? Option A, in the regular trash can. Option B, in a biohazard bag. Option C, in the laundry hamper. Option D, down the toilet. The correct answer is option B, in a biohazard bag. Ostomy pouches contain body waste and must be handled as biohazardous material. Question 355. What is the appropriate diet for a resident with dysphagia? Option A, high fiber and seeds. Option B, thickened liquids. Option C, whole meats and raw vegetables. Option D, clear liquids only. The correct answer is option B, Thicken liquids. Thickened liquids are easier to control and swallow, reducing the risk of aspiration. Question 356. What is the number one thing that a nursing assistant should report to the nurse immediately? Option A. A resident who is sleeping. Option B. A resident who has trouble breathing. Option C. A resident who refuses a snack. Option D. A resident who wants to watch television. The correct answer is option B. A resident who has trouble breathing. Respiratory distress is a medical emergency that requires immediate intervention. Question 357. What is atrophy? Option A. The growth of a muscle. Option B. The wasting away or decrease in size of a muscle. Option C. A type of severe headache. Option D. The process of a wound healing. The correct answer is option B. The wasting away or decrease in size of a muscle. Atrophy is common in residents who are immobile or have certain diseases. Question 358. How many milliliters are in 1 fluid ounce? Option A, 10. Option B, 30. Option C, 60. Option D, 100. The correct answer is option B, 30. 30 milliliters is the standard medical conversion for 1 ounce. Question 359. What is the most common cause of choking in a care facility? Option A, drinking water too fast. Option B, a large, pearly chewed piece of meat. Option C, taking a large pill. Option D, eating a bowl of soup. The correct answer is option B, a large, pearly chewed piece of meat. Properly prepared food and monitoring during meals can prevent choking. Question 360. Why is there a small hole at the bottom of anti-embolism stockings? Option A, to allow the feet to breathe. Option B, to check circulation in the toes. Option C, because they are poorly made. Option D, to help pull them on. The correct answer is option B, to check circulation in the toes. Checking for color and warmth through the hole allows monitoring of blood flow. Question 361. When do most falls occur in a nursing home? Option A, at night and after meals. Option B, during the middle of the day. Option C, during the morning shift change. Option D, only during activities. The correct answer is option A, at night and after meals. Fatigue and increased confusion at night contribute to higher fall risks. Question 362. What is the difference between grab bars and handrails? Option A, handrails are in the bathroom and grab bars are in the hall. Option B, handrails are in the hallway and grab bars are in the bathroom. Option C, there is no difference between them. Option D, grab bars are for the bed and handrails are for chairs. The correct answer is option B, handrails are in the hallway and grab bars are in the bathroom. Both are safety features designed to help residents maintain their balance. Question 363. How can Clostridium difficile be killed effectively? Option A, with an alcohol-based hand sanitizer. Option B, with soap and water. Option C, by using a dry paper towel. Option D, with clear water only. The correct answer is option B, with soap and water. Friction and soap are necessary to remove the spores of Clostridium difficile. Question 364. What is involuntary seclusion? Option A, allowing a resident to be alone in their room. Option B, separating a person from others against his or her will. Option C, giving a resident a private bath. Option D, taking a resident to a quiet activity. The correct answer is option B, separating a person from others against his or her will. Involuntary seclusion is a form of resident abuse and is illegal. Question 365. If a resident starts to fall, what should the nursing assistant do? Option A, try to grab their arm and pull them up. Option B, ease them to the floor. Option C, step back and watch them fall. Option D, scream for a chair. The correct answer is option B, ease them to the floor. Easing the resident down prevents injury to both the resident and the assistant. Question 366. What is the primary goal of a bladder training program? Option A, to force the resident to drink more water. Option B, to gain control of urination. Option C, to ensure the resident uses a diaper. Option D, to stop the resident from urinating at night. The correct answer is option B, to gain control of urination. Bladder training helps residents regain continence and independence. Question 367. How long do you wait to take an oral temperature after a resident eats, drinks, or smokes? Option A, 2 minutes. Option B, 15 to 20 minutes. Option C, 1 hour. Option D, no wait is required. The correct answer is option B, 15 to 20 minutes. Waiting ensures the oral cavity temperature has returned to its normal baseline. Question 368. What is a condom catheter? Option A, a tube inserted into the bladder. Option B, a soft sheath that slides over the penis to collect urine. Option C, a device used to drain a wound. Option D, a type of internal female catheter. The correct answer is option B, a soft sheath that slides over the penis to collect urine. Condom catheters are non-invasive and used for male residents with incontinence. Question 369. What are common signs of an infection? Option A, hunger and thirst. Option B, redness, sweating, fatigue, and fever. Option C, being happy and energetic. Option D, having clear urine. The correct answer is option B, redness, sweating, fatigue, and fever. Physical changes like fever and fatigue often signal the body is fighting an infection. Question 370. Which two blood-borne pathogens are of the most concern in healthcare? Option A, influenza and the common cold. Option B, human immunodeficiency virus and hepatitis B. Option C, staphylococcus and streptococcus. Option D, measles and mumps. The correct answer is option B, human immunodeficiency virus and hepatitis B. Standard precautions are designed to protect against these serious blood-borne diseases. Question 371. What kind of gloves should you use when cleaning up a chemical spill? Option A, standard latex gloves. Option B, rubber utility gloves. Option C, no gloves are needed for cleaning. Option D, plastic food service gloves. The correct answer is option B, rubber utility gloves. Utility gloves provide better protection against harsh cleaning chemicals. Question 372. What should be used to clean the drain on a urinary drainage bag? Option A, a wet washcloth. Option B, an alcohol wipe. Option C, a dry paper towel. Option D, strong bleach. The correct answer is option B, an alcohol wipe. Alcohol wipes disinfect the port to prevent bacteria from entering the drainage system. Question 373. What does a pulse oximeter measure? Option A, blood pressure and temperature. Option B, oxygen percentage in the blood and heart rate. Option C, respiration rate and height. Option D, the amount of urine output. The correct answer is option B, oxygen percentage in the blood and heart rate. A pulse oximeter provides a quick assessment of a resident's respiratory status. Question 374. What is the normal range for oxygen concentration measured by a pulse oximeter? Option A, 80% to 90%. Option B, 95% to 100%. Option C, 50% to 60%. Option D, 100% to 110%. The correct answer is option B, 95% to 100%. Levels below 95% should be reported to the nurse immediately. Question 375. What is peristalsis? Option A, a type of heart condition. Option B, involuntary muscle movement throughout the digestive tract. Option C, the process of breathing. Option D, the way a person walks. The correct answer is option B, involuntary muscle movement throughout the digestive tract. Peristalsis moves food and waste through the stomach and intestines. Question 376. What is the typical consistency of stools from a colostomy? Option A, always liquid. Option B, semi-liquid to formed. Option C, hard and dry. Option D, clear and watery. The correct answer is option B, semi-liquid to formed. The consistency depends on where the colostomy is located in the large intestine. Question 377. What is the typical consistency of stools from an ileostomy? Option A, formed and hard. Option B, liquid. Option C, thick and pasty. Option D, solid like a normal bowel movement. The correct answer is option B, liquid. Because the large intestine is bypassed, the stool remains in a liquid state. Question 378. What are the two primary types of communication? Option A, loud and quiet. Option B, verbal and nonverbal. Option C, fast and slow. Option D, happy and sad. The correct answer is option B, verbal and nonverbal. Nonverbal communication includes body language, gestures, and facial expressions. Question 379. What is the appropriate temperature for a soapsuds enema? Option A, 120 degrees Fahrenheit. Option B, 105 degrees Fahrenheit. Option C, 90 degrees Fahrenheit. Option D, 70 degrees Fahrenheit. The correct answer is option B, 105 degrees Fahrenheit. Water that is too hot can burn the resident, and too cold can cause cramping. Question 380. What conditions generally promote the growth of bacteria? Option A, light, cold, and dry areas. Option B, dark, warm, and moist areas. Option C, bright, hot, and sunny areas. Option D, clean, sterilized, and frozen areas. The correct answer is option B, dark, warm, and moist areas. Maintaining a clean and dry environment is key to preventing bacterial growth. Question 381. What temperature of water should you use to clean dentures? Option A, hot boiling water. Option B, cool or lukewarm water. Option C, freezing cold water. Option D, no water is needed. The correct answer is option B, cool or lukewarm water. Cool water prevents the denture material from warping or losing its shape. Question 382. Which condition is a barrel chest commonly correlated with? Option A, dementia. Option B, emphysema. Option C, arthritis. Option D, diabetes. The correct answer is option B, emphysema. The lungs stay overinflated with air in emphysema, causing the chest to expand.